8, 2021. Mr. President, the following bills passed the House in an amended form. Message number 173, House Bill number 10, COVID-19 Large Business Relief Program, ayes 35, noes 24, conflict 1. Message number 176, House Bill number 76, Uniform Statewide Payment Processing, ayes 56, noes 4. Message number 177, House Bill number 85, Unlawful Dissemination of an Intimate Image, ayes 60. Message number 178, House Bill number 87, Provider Recruitment Grant Program Repeal, ayes 55, noes 5. Message number 179, House Bill number 103, Journalist Privilege Communications, ayes 37, noes 23. Message number 180, House Bill number 135, Hank Co. Leadership Highway Designation, ayes 54, noes 6. Message number 182, House Bill number 17, Range Management at Military Training Areas, ayes 38, noes 22. Message number 183, House Bill number 118, Food Freedom Act Amendments, ayes 55, noes 5. Message number 184, House Joint Resolution number 3, State Lands Mineral Royalties Constitutional Amendment, ayes 40, noes 20. Signed, Wendy Harding, House Chief Clerk. From the House of Representatives, Mr. President, the following bills passed the House on third reading. March 8, 2021. Message number 174, House Bill number 46, Crime of Bestiality, ayes 60. Message number 175, House Bill number 65, Political Subdivisions Deposits, ayes 53, noes 7. Message number 181, House Bill number 148, Fees Paid to Secretary of State Amendments, ayes 45, noes 15. Signed, Wendy Harding, House Chief Clerk.
Reports from standing committees.
March 8, 2021, Mr. President, your committee number 1, Judiciary, to whom was referred Senate File 98, bail source hearings, respectfully reports same back to the Senate with a recommendation that it do pass. Ayes, Senators Cooper, Kolb, and Cost. Absent, Senators French and Nethercott. Senator Nethercott, Chairman. Message number March 8, 2021. Mr. President, your committee number 1, Judiciary, to whom was referred Senate File 123, Lottery Games Keno, respectfully reports same back to the Senate with a recommendation that it do pass. Ayes, Senators Cooper, French, Kolb, Cost, and Nethercott. Senator Nethercott, Chair. March 8, 2021, Mr. President, your committee number 1, Judiciary, to whom was referred Senate File 66, Slayer Rule applied to joint ownership, respectfully reports same back to the Senate with a recommendation that it do pass amended. Ayes, Senators Cooper, French, Kolb, Cost, and Nethercott. Senator Nethercott, Chairman.
Mr. Majority Floor Leader. One more time, please, sir.
Mr. President, I move that, gotta read my script. Move that the Senate resolve itself into committee of the whole. You said you gotta read it twice, isn't it? Re-resolve.
You've heard the motion. All in favor, say aye. As opposed, no. Senator Case, continue to take us through the budget.
See how good I am on my feet? I have to read it even though it's one sentence.
Hey, Chairman Nethercott. Chairman Nethercott. Those are here and
Committee of the Whole will come back to order. The next section for our consideration is section 11, Department of Revenue. Senator Guru.
Thank you, Mr. Chairman. I bring you to Section 11, Department of Revenue, number 8 on your summary sheet, number 21 on your budget. The governor's reductions amount to $2,211,564 in this department. And if you'll direct your attention to footnote number 3, the JAC adopted the governor's reduction recommendation of $1,704,000 general fund to include the reduction of one full-time position. It's one of 3 in the department. for $190,544 for 100 series personnel, $265,000 for 200 series support services and IT hardware, and $1,247,679 in general fund series for 900 series contract services for removal of the funding for the property tax refund program for 2022. And I will stand for questions.
Is anybody going to rise for questions while he's standing for questions? Not seeing any, not seeing any. No questions? Section 11 is closed. Next section is section 15, Attorney General, Senator Hicks.
Chairman, Section 15, Attorney General's Office, Governor's reduction resulted in a reduction of $4.87 million. Removal of 8 FTEs and 1 part-time position. JAC further amended, removed 2 more FTEs from the Attorney General's Office for an additional reduction of $228,000. Total reduction for this agency was 7.9%. Mr. Chairman, unless there are further questions, that concludes an explanation of Section 15, Attorney General.
Any discussion on section 15, Attorney General? Any discussion? Any questions? Seeing none, that section's closed. The next section for our consideration is section 20, Department of Environmental Quality. Senator Hicks.
Mr. Chairman, Section 20, Department of Environmental Quality. The governor's reduction was for $6.85 million, a reduction of 8 FTEs. No further action by the Joint Appropriations Committee resulted in a total reduction of 11.2% from Agency 20. Unless there's further questions, that concludes an explanation of Section 20.
Any questions about section 20? Any questions? Seeing none, that section's closed. The next section for our consideration is section 21, Department of Audit. Senator Kinsky.
Just privilege of the floor, Mr. Chairman. Just
Absolutely.
briefly.
The privilege is yours.
Somebody left on my desk a manila file folder that says business property tax that I cannot, oh, there we go.
I bet I do know who that is. It's in its business personal property.
I knew somebody'd want it back.
I know somebody that's working on that. Senator Perkins, are you going to help us with the Department of Audit?
No, I was just going to say, I think that they wanted Senator Kinsky to pay those taxes.
Senator Ellis for the privilege.
Thank you, Mr. Chairman. I think that'll be 7 cents.
Well played. Senator Steinmetz, are you going to get us back on track?
Yes, Mr. Chairman, thank you. So Agency 21 is found on page 11 of your summary sheet and page 25 of your budget bill. The Department of Audit reduced the general fund budget by $1.172477 million for a total general fund reduction of 8.65%. The JAC adopted all the governor's recommendations, which included a reduction of 4 full-time employees. And if there are no further questions, that concludes the explanation of section 21.
We do have questions. Senator Landon.
Thank you, Mr. Chairman. Just a quick one with regard to the Department of Audit, Department of Revenue. We have always been cautious on that front. I see where there's 4 FTEs that we're eliminating there. Can you give us any insight as to what are those? What kind of boots on the ground are we talking about here? And maybe backing up to revenue. I didn't ask the question there, but that's how we retrieve some of the taxes out there. So thank you, Mr. Chairman.
Thank you very much, Senator Landon. Any other questions? Any other questions? Senator Steinmetz, can you help us?
Mr. Chairman, as far as I can recollect, those were the new auditor positions that they don't generate as much money as some of the seasoned auditors. We were going to let those go for now, but I will try to find more information on that for you and get that to you, Chairman Landon.
Thank you, Senator Steinmetz. Senator Drew.
Thank you, Mr. Chairman. And the one for sure in the Department of Revenue was from the tax program. And I'll get an answer for the other. Thank you. Yes, for both.
Thank you very much, Senator. Any other discussions on section 21, Department of Audit? Any other discussions? Seeing none, section 21 is closed. The next section for our consideration is section 24, State Parks and Cultural Resources. Senator Steinmetz.
Thank you, Mr. Chairman. Section 24 can be found on page 12 of your summary sheet and 26 through 28 of your budget bill. The total reductions in FTEs are 12 and part-time employees 17 for a total of 29 positions. Footnote number 2 on your summary sheet corresponds with footnotes 2 and 3 in your budget bill to sustain the governor's reductions, and number 7 in your budget bill to sustain the grant awards to subrecipients for the Federal National Endowment for the Arts. Footnote 8 on page 28 of your budget bill directs the Department of State Parks and Cultural Resources to engage in a memorandum of understanding with the Wyoming Military Department for the operations of the Veterans Museum in Casper and allows for funds to be used. This was a House position and the vote was 5-7.
Thank you, Senator Steinmetz. Questions for Senator Steinmetz on section 24? Any questions on section 24? Seeing none, section 24 is closed. The next section for our discussion is section 27, State Construction Department. Senator Steinmetz.
Thank you, Mr. Chairman. Section 27 can be found on page 13 of your summary sheet and page 29 of your budget bill. The JAC restored 1 full-time employee in the project manager position, which is explained on page 30, footnote 2 of the budget bill. The State Construction Department reduced the general fund by $279,373 for a general fund reduction of 8.65%. It also changed the major maintenance multiplier from 2 to 1.5%.
Thank you, Senator Steinmetz. Questions on section 27? Any questions on section 27? Seeing none, section 27 is closed. Next section is section 32. It's a strikeout section. Do we have to do that one? Section 32 is closed. Next section is section 37, State Engineer. Senator Hicks.
Mr. Chairman, section 37, State Engineer's Office. Governor JAC adopted the governor's recommendation for a recommendation of reduction of 1.573 million. The elimination of 7 FTEs. Moved 1 of those into a part-time employee for a total reduction of 6 employees. JAC took no further actions, resulted in a total reduction to the State Engineer's Office of 12.5%. Unless there are other further questions, that concludes an explanation of section 37, State Engineer's Office.
Questions? Senator Boner, let's start with you. Oh, sorry. Just got to go, huh? Senator Hicks. Anybody else? Anybody any other questions on section 37? Seeing none, section 37 is closed. The next section for our consideration is section 39. Senator Hicks.
Mr. Chairman, section 39, Wildlife and Natural Resource Trust. Governor's recommendation was a recommendation of reduction of $1.6 million. No reduction in force. There's only 2 people in that entire agency. JAC took no further action, resulted in a 16% reduction of the agency's budget.
Okay, any questions? I'm sorry, go ahead.
Unless there's any further questions, that concludes an explanation of section 39.
Let's start with Senator Landon, then we'll go to Senator Guru.
Thank you, Mr. Chairman. Having served on that committee, I know how tight that budget is anymore. I'd be curious also to kind of know a little bit more about that cut to that agency. I don't really understand how we could cut them 60%, but maybe I can have an offline conversation and find that out. So thank you.
Thank you, Senator Landon. Senator Guru. Back to you, Senator Hicks. Oh, now make up your mind, Senator. Senator Guru.
I'm sorry, Mr. Chairman, I asked a question. I'm just here to present the next line.
I see.
The next part.
You're kind of getting antsy, aren't you?
Yeah.
Senator Perkins.
Thank you. Just to going back to that particular budget reduction, if you just give me just 1 second, I'll answer that question.
So the budget reduction
On the
Wildlife and Natural Resources Trust, section
Yes.
39.
yes, sir.
I'm just buying you time by talking
And I
very
appreciate
slowly.
that.
Senator Hicks, you want to buy us some time?
No, I'll answer the question.
Okay, let's hear it.
Mr. Chairman, that was a $1.6 million reduction out of their project accounts. They derive interest off of that, off the corpus of that trust. That generates about $3 million a year. And the actual budget, we did some additions. I believe it was $7 million in the budget. So we've come back and reduced that by $16 million. They still have enough money in that account to fund the projects through the biennium that they anticipate. But it was a reduction, and they'll have to turn some projects back that won't be available for funding.
Thank you.
Hope that answers the question.
Thank you. And Senator Perkins, did you want to tag on?
Right, and then the other thing I would add too is the other action was taken was that we went and the JC, and I think the governor was recommended this too, was it actually also deleted footnote number 2 in the original budget. And what that did is that restricted $1 million that was appropriated for the Wyoming Landscape Conservation Initiative and required matching funds for that to come in. That footnote's now been struck. So now that $1 million goes back, and it's back and can be used for whatever general purposes that they want. So while there was a restriction in that, there was a loosening of restrictions on other monies so that the board and the department can go ahead and fund other initiatives that they believe are of appropriate priority, whether they're conservation or whether they're something else.
Thank you, Senator Perkins. Further questions, further discussion? Seeing none, section 39 is closed. The next section for our consideration is section 41, fire prevention, electrical safety. Senator Guru, you're finally here. I've been waiting all day.
I've been waiting all day for this. Thank you, Mr. Chairman. Page 15 of your summary sheet, page 34 of the bill is the fire department, section 41, fire prevention, electrical safety. You see, the governor took out on $814,189. But then if you follow along, it only has 100,000. What happened here is we just converted fees payments and use those to take, instead of taking general fund dollars, use fees that are generated by the department to help fund that reduction. So that's how the funding came out. Any questions?
Thank you very much, Senator Perkins.
And just to add on, I mean, this one was really interesting as you went through because ultimately what this department did in order to cover their reductions was they raised the fees, which they have the ability to do under statute. So this one was a little bit interesting, but just as an FYI.
All right, thank you. Questions about section 41? Any questions about section 41? Seeing none, section 41 is closed. Next section is section 42, geological survey. Senator Guru.
Mr. Chairman, page 16 of your summary sheet and page 35 of the bill, you'll find the geological survey. See a total department cut of $700,869, and this is from 3 FTEs. And with that, I'd be glad to stand for any questions on the Department of Geological Survey.
Any questions on section 42? Any questions? Any questions on section 42? Seeing none, section 42 is closed. Next section is 44, Insurance Department. Senator Group.
Thank you, Mr. Chairman. This is still on page 16 of your summary sheet and page 36 of the bill. You'll find section 44, the Insurance Department, with a cut of $661,853. JAC, if you'll see footnote number 2, JAC reduced $150,000 of general fund for the 600 series grants and aid payment and added footnote number 1 to biennialize the reduction. And that money came from the Wyoming Health Insurance Pool.
Thank you, Senator. Questions on section 44, insurance? Any questions? Seeing none, that section is closed. Hey, everybody, you know how we've been rolling along pretty fast so far?
Yeah.
Pretty cool, huh? That's about to change. The next section is 48, Department of Health. Senator Kinski.
Thank you, Mr. Chairman. If there's no further questions. Yeah. So Department 48, I think this one and the following Department of Family Services are probably responsible for 90% of the email about cuts you've gotten, with the exception of education. And I'm going to walk you through this in more detail than is available on this summary sheet, because I know there are particular sections about which you will have questions and concerns. The reason Department of Health and Family Services are undergoing so much change and reduction is it's over a third of all general fund dollars. So if you're going to affect reductions in the budget, you have to effect reductions in these budgets. And the Department of Health, these folks do not like any of these choices any better than you do, or any of the beneficiaries, or any of the providers do. But they're faced with a situation of triage, with given nothing but bad options, you have to pick the least bad options. And so that's what I'll walk you through. Some of these are just administrative things that I'll quickly skip over so I can get to the more substantive things. On your handout, though, you will see there are 4 large areas where there are reductions: the director's office, healthcare financing, public health, and behavioral health. And I will walk you through the reductions in each of those. The director's office, there's not a lot, but it is important to understand that the director's office did cut 3 positions. In their own office, they eliminated 1 full-time and 1 part-time position. In the Department of Vital Statistics, they eliminated a position as well. So that with respect to the director's office, they started at the top. Next is healthcare financing. The first unit is healthcare finance administration. They effected 1 cut of about $3 million by restricting travel, restricting what they're paying on some software, ending any paper billing by providers, making it all mandatory electronic, which is a substantial part of the savings. And then they are ending some support to providers to help them achieve quality certifications. They just don't have the money to provide that kind of provider assistance anymore. Also in that same division, the unit is Children's Health Insurance Program. So the Children's Health Insurance Program, this is a substantial reduction of $10 million. The program was put out to bid for administration by outside providers. And this time around, they received nobody to bid on that. And it's being brought in-house, so they will save some money on the cost of administration. But the greatest savings are they're going to move from what was the private providers' allowed rates for services, and they're moving it to Medicaid rates. So effectively, it's a significant cut to all children's health insurance payments. Again, under healthcare financing adult services, there was a step 2 reduction of 2.5% to all allowed provider types, whatever providers, whether it's doctors, nursing homes, it doesn't matter, 2.5%, unless for some reason they were exempt from that by federal regulation and so forth. And then again, they circled back on phase 3, step 3, and another 2.5%. So every provider right off the bat has taken a 5% haircut. And that is a significant savings of $56 million, and I believe another a like amount with the subsequent 2.5% step. And then all of these, I should add, part of it, of that 56 million, 28 million is savings to the general fund, but we're also walking away from a 1-to-1 match from the Fed. So we're also walking away from $28 million worth of federal funds. Then there were some administrative savings and technical savings within adult services. For one, during the COVID crisis, the feds upped their amount of match on Medicaid from 50% to 56%. So there's a one-time savings of $16 million. We're just swapping out general fund dollars for those federal COVID dollars. That will just be a one-time savings. And then there's savings such as through the Wyoming Life Resource Center. They're cutting what they're paying on their provider contracts and a variety of other things to get to some savings there. Next is under adult services, elimination of the state supplemental SSI payment. So you may be familiar with SSI. It's Social Security Supplemental Income. Somebody is entitled to that payment. The state historically has given them a little supplement if that is their only income source. And so that was going to be completely eliminated until we found out that under federal rules, if we completely eliminated it, we lost funding under other programs. So we're going to maintain that program, but the amount that we will pay to beneficiaries is being reduced to the absolute dead level minimum allowable by law. Next is, it's not a big one, but everybody who is receiving any generic prescription drugs, it's going to be a mandatory 90-day supply instead of being refilled every 30 days. The state just pays cost plus a $10 fee. Instead of paying that $10 fee every 90 days or 30 days, it's now going to be paid every 90 days. Then with respect to behavior, this is under healthcare finance, children's services. With respect to behavioral health services for children, they are being put on the same utilization management program as all other behavioral health visits. There will be a maximum of 30 visits per year. Anything over that has to be submitted to the Department of Health and reviewed and approved. And that's anticipated to be a substantial amount of money. Same division unit, out-of-home placements for children. They're going to change the billing practices for behavioral health group therapy sessions. Right now, they pay in 15-minute increments. That's going to be going to, you get a payment, whether it's 15 minutes or 30 minutes or 40 minutes, you're going to get the same payment. And no more than 2 therapy sessions per day. And that's just to avoid people saying, well, if you're not going to pay me for 2 15-minute sessions, I'll just do 2 sessions back to back. And so it's a means of just trying to avoid any kind of gaming of the system. Okay, next. Healthcare finance, out-of-home placements, children. The Children's Mental Health Waiver and Care Management Entity Programs, AKA the wraparound. Okay, so you've all gotten some mail about this. So the waiver is a program that allows for these services for non-Medicaid eligible populations. If somebody is Medicaid eligible, they can still receive the WRAP services, but without being on a waiver of the need for Medicaid eligibility. So the idea of these 2 programs was to try to find a way to avoid PRTF, psychiatric residential treatment facilities. It's a means to try and avoid severely disturbed children from having to go to an inpatient facility. So before we dig down into the details of the program, the first and most important thing to know is that the department cannot establish that anything has been saved from this program as a consequence. It looks like the waiver is an additional expense, not savings, instead of in-treatment patient. So why is that? Well, it could be that the less severe patients are able to maintain outside of residential treatment, and the more severe ones still go to residential treatment anyway. But the entire program was started as a means to avoid inpatient treatment, and it does not look like it succeeded in that regard. So that, coupled with the fact that there are a substantial portion of this population that are not Medicaid eligible, led the department to say, let's cut this program. So those are a couple elements that you need to understand. And our chairman was here for much of this. There were some reform efforts on this program, first in, I believe, in 2014, whereas the program expenses grew and grew and grew. What they did is they said, well, we're going to take everybody who's already on service, that's the comprehensive waiver, and we're going to set them over here and we're going to grandfather. And we've got this methodology that takes the level of impairment and the age and other factors and says, here's the level of service we think you should get to keep you from being institutionalized. And the comprehensive waiver can be very, very expensive. All the new enrollees went on to something called the supplemental, which has a cap, and no, that's the DD waiver. I'm sorry, I'm getting my waiver programs mixed up. Let me go back to this. So I'm sorry, I started talking about DD. Under this program, with its elimination, approximately 250 children are served that would lose these supplemental benefits. they would continue to receive regular mental health benefits offered to everybody on Medicaid. 55 children do not qualify for Medicaid without the waiver. And if their family income, because their family income exceeds normal Medicaid eligibility guidelines, it's hoped that they would have private insurance available to them since there is mental health parity, and some of them may shift on to CHIP if they are financially eligible for that program. So that is the wraparound program. Okay, next is under nursing facility services, ending the PACE program. That was a program in Laramie County, unique to Laramie County, where they tried to deliver Medicaid services on a bundled basis, seeing if cost savings would come from it. And that did not work out. So that program is being abolished, and those folks will go back to traditional Medicaid. Next, healthcare financing, optional services adult. You may have gotten email about this one. Elimination of coverage of dental and vision services for adults. It's optional. We are not required by the federal government to provide vision or dental programs for adults. And so that program is on the chopping block, and it's, people will be hurt by it, but the cuts have to come someplace. Likewise, elimination of coverage of chiropractic services. Not a lot of money. You may have heard about it from back home, though. Again, it's an optional service we're not required by the federal government to offer. And when we're trying to pay for nursing homes and psychiatric treatment, chiropractic services just went to the bottom of the priority list. Next, under long-term care waiver services, elimination of what's called Project Out. This is targeted case management to try and keep people out of nursing homes, different than the WISE program, which we're coming to shortly. Okay, now we are on comprehensive waiver. Reductions to the comprehensive and support waiver services for persons with developmentally disabilities and acquired brain injuries. So this begins with an evaluation that individuals receive of the degree of impairment and other factors to determine what level of service they would be eligible for. And again, that was capped in 2014. The folks already on service were grandfathered and told that their rate of service would not change plus or minus by more than 7.5% under the new methodology. All new services went to what's called a support waiver that has a cap of, I believe it's $27,000 per year. To get a handle on the program, the department has a series of initiatives. First is to apply to everybody, including those who are grandfathered under the 2014 overhaul, the same methodology as those who came on after 2014 without the plus or minus 7.5% limit, so that it won't change the evaluation of what they're entitled to. It will change the budget that they receive. And that has caused a high degree of concern amongst those that have been grandfathered, because they will now be paid on the same basis, the same methodology as those who are not grandfathered. The second is there's something called the Extraordinary Care Committee, and that hears appeals where somebody feels like they're entitled to more services than the methodology entitled them. And those requests are going to be frozen and limited just to those on an emergency basis. That is, that there has been a significant loss of physical or cognitive function, and on an emergent basis, there must be an adjustment to the services that they receive. The other is a freeze on the waiting list. There are 400 and some people on the waiting list now, and they are going to freeze any new admissions to the program. And so the waiting list will continue to grow. And then the other means of getting a handle on the program, of course, are the across the board provider cuts. And then these people will, like many others, be affected by the elimination of adult vision and dental care. Of note from the department is the level of service that is received under the wraparound is significantly higher than the base medical coverage that's received by all Medicaid beneficiaries. So it is a net increase in the amount of coverage and service that's available, and that will still be the case, just not at the level that has been true for some in the past. And again, it's not due to a change in how they assess the level of service, but simply getting rid of that grandfathering provision from 2014. Now, what they said is because of that, let me see if I can get that statistic for you. The number that will lose and the number that will win. 1,054 individuals will see a decrease in their individual budget amounts. They believe most of these are the pre-2014 individuals that were grandfathered in and told there would not be more than plus or minus 7.5%. And some will see much larger reductions than others. About 819 individuals will actually receive a budget increase, but the amount of decrease dollar-wise is going to be significantly more than the amount of increase dollar-wise. Now, the department is continuing to look at this, and some of those, the people that are going to be losing, they are actually finding that it's a small group of outliers that they're looking at exactly how to deal with that. There's in fact one situation where I think it was $300,000 a year worth of services that would be substantially reduced. And so they are concentrating to see if the lion's share of the savings, how they can deal with those particular situations. And I will circle back to the department to get some more detail on that. But, you know, this is just, we grandfathered in 2014 and 2021 can't afford the grandfathering. It's really as simple as that. Moving on, again, on the comprehensive waiver, a while back, there was a swap of tobacco funds for general funds. Now we're re-swapping it to put the tobacco funds back for the general funds. And next now is healthcare. Now we're on to public health. Public health, there's some small reductions in travel, training, that sort of thing, administrative overhead. None of those, they amount to significant money, but it's not as big as some of the other reductions. 100,000 here, 100,000 there, $500,000 there. Rural and frontier health is taking reductions in terms of travel, training, and this is a program that's very important to some counties where they don't have the kind of infrastructure larger areas do. And there are also reductions to the state aid to some of those rural health programs, and as well as elimination of state aid for provider recruitment grant program, loan programs, which is also going to require HB 87 to pass, that makes one of these programs contingent on funding. So a variety of rural health programs that are being reduced or cut. Under immunization, we have a program called Wyoming Vaccinates Important People that provides vaccines through public health offices and rural healthcare centers, as well as to private providers. This is going to end the provision of the vaccines to all but the public entities, which means 74 private providers are going to need to purchase private vaccine stocks. And it is hoped that they could then bill insurance for those and recoup that expense. Again, under reduction of immunization programs, hepatitis A and B, vaccines are being provided through county public health offices, as well as the Department of Corrections. This reduces the amount of funding for the provision of those, including through the public health offices. Maternal and child health services, reduction of training, reduction of travel, reduction of a position, And then distribution of duties. And let me see what else. It's going to be swapping out of some funds. And again, it's $500,000, but I just want you to understand that they're trying to hit every aspect of the program. Okay, under women, infants, and children, the contracts paid for the management information systems and the electronic benefit transfers are going to be reduced. Under public health nursing, reductions in out-of-state travel and administrative expense. Cancer screening, reduction in travel, reduction in number of colonoscopies covered by the Wyoming Cancer Treatment Program. Public health laboratory, reduction of administrative expense and in-state and out-of-state travel. Communicable disease program, reduction in funding for HIV medications and medical services associated with the Ryan White program. So these are funds that are used to provide emergency access to HIV medications and services while processing applications to determine eligibility. That will no longer be provided. Injury and chronic disease prevention, administrative cuts to travel, substance abuse and tobacco prevention, reduction in grants and aids to the county prevention grants that are currently going out, and then swapping tobacco funds back into the program to save some general funds. Now we're on to behavioral health administration. And I'm starting with administration where they have a series of different sorts of cuts that amounts to $300,000 in the administrative office. Then in the recovery supports. Under recovery supports, there are 4 major programs. The behavioral health recovery supports, they're eliminating a position. And then in funding to, let me see, this one is just an overall reduction to various programs dealing with mental health or substance abuse disorders. And then reduction in the court supervised treatment program. And the big ones, eliminating a program at the Wyoming State Hospital. Reducing the rates the state hospital pays to outside providers. Then we get to outpatient mental health, outpatient substance abuse, and substance abuse, inpatient substance abuse and outpatient substance abuse. Cuts to all 4 of those programs, significant cuts. And it is one of the second highest general fund expenditures the Department of Health has. And they were exempted from step 2, but the step 3 cuts are bigger as a consequence. What the department has been doing is working with these providers, principally the community mental health centers, and they are going to provide flexibility among the 4 types of funds so that if they have money left over from substance abuse, inpatient, they can use it in mental health, outpatient, and so forth, so they can flex those dollars around. And to this day, it befuddles me as to why there are so few federal dollars flowing through this program and such a huge proportion of general fund money. And a lot of it goes back to 2007, when the funding for these programs was more than doubled, from about 50 million to over $100 million. It's being cut back to about $92 million. There is House Bill 38, which is authorizing the Department of Health to explore alternative funding options to include Medicare waivers and so forth. Now, whenever I hear Medicaid waiver, I always worry they're really not going to save much money, because some of these waiver programs tend to kind of come back on you and bite you. With respect to preschool services, that is the child development centers. This is part C for children birth through age 2, and part B, children age 3 to 5, developmentally disabilities. and screening and treatment of those, early identification, early intervention. And this one breaks my heart because I'm a big believer in the work this program does. But they are eliminating all contingency funding in the budget in the event that there is an increase in the child count. And so they said it exposes the program to the risk that there are going to be an increase in the number of children in the program that won't be funded. And then the remainder is going to, it's just a cut. That's going to be reduce the amount of services provided and to those children identified with developmental delays, $4 million. So that is now the one bit of relief that came for the child care centers is during the COVID epidemic, their child counts fell. And the governor did send us a letter that says, let's go ahead and pay them based off of their 2019 child count to try and reduce the cumulative impact of all these cuts. And JAC did adopt that. Another area is we are required by law to look at the costs experienced by these centers and determine whether there has been an increase in their costs, and has been the case for many years. We determined, yes, their costs have gone up, but no, they don't get an increase. Next is respite care, not a whole lot of money, but this is for parents of children with developmental disabilities who are on the waiting list for the wraparound to give them some relief. Respite care program that will be eliminated. About 65 families annually affected by that. Then under aging administration, what is called the community living support reduction. This is support to community providers for staff training, development, advocacy. That's a 28% reduction. And now we come to WISE, Wyoming Home Services Reduction, a phased-in reduction to the program to try and help people avoid going into the nursing home. A couple of things to consider. First, that portion of the program of this type of program, which is not WISE, but that portion, which is another program we fund, that is for Medicaid eligible populations, is not affected. This program is for non-Medicaid populations. And I've been an advocate for it in the past, and I voted for the expansion of it in the past. And regretfully, the department has said that we've got to make decisions, and a non-Medicaid population, they have asked to eliminate the program. And so we've all gotten the emails about how valued the services are, and I will agree that they are valued. The question is, the intent of the program originally was that it would avoid nursing home and avoid increased Medicaid expenses to the state. And the department says they cannot prove that that has happened. They cannot prove that we have added a program and that has reduced the Medicaid expense to the state. Now, it has provided a valuable service to a lot of non-Medicaid eligible seniors. But as to whether it has reduced Medicaid nursing home expense is an open question. Now, the department said, of course, we can't say that it hasn't either. We just don't have the evidence that it has really worked in the way intended. And so a lot of hard choices to be made, and this is one of them, regretfully. And then a small reduction to the Wyoming Senior Services Board, which oversees the programming for 39 senior centers. Moving on in the aging division, healthcare licensing and surveys, elimination of a position. Aging, veterans home, 20% reduction in supportive services. The Veterans Home Administrator believes that they can achieve a variety of cost-saving measures, including buying from out-of-state vendors, a practice they've avoided in the past, but they can save money by going out of state. And with that, I appreciate your patience as I went through 1/3 of the state budget way too quickly, but I know that there are just about a half a dozen that are of particular interest. I'll stand for questions.
Thank you very much, Senator Kinski. Senator Cooper.
Thank you, Mr. Chairman. A couple of observations here. I spent about an hour and a half on the phone with a provider in my area. She provides home care, health care to the most needy in our area. Not the people that need psychological help, not the people that need vision and dental. These are the people that need their diaper changed and needs food fed. This reduction, which in my limited mathematical skills comes to about 8% across the board, 4% on admin, results in a 40% cumulative reduction to the client. By the time we reduce all of the different programs. That 40% reduction means that 3 of her 6 clients have to go into this, back into the system, into the state hospitals, wherever they may be. And 3 of her employees go away. So this employee number that we're seeing is skewed because those are state employees. Those are not the direct employees, the people that are out there actually providing the care. I'm not even educated enough to know what questions to ask. So my question to the good senator back here and to the appropriations committee that worked so hard on this, you guys are, I can't imagine how many thousands of hours are involved in this, but what do we tell these folks? And how do we get them at least enough relief to where they can keep the diapers changed and food on the table for these folks? Thank you.
Thank you, Senator Cooper. Let's get another question or two. Senator Furphy.
Thank you, Mr. Chairman. Probably others been contacted.
Senator Furphy, your microphone, what might work on your deal is to come up and people come in front of their desk and speak back if you wish to.
Okay, thank you, Mr. Chairman. Is that better?
It's better, but you're welcome to swing around your desk and set your microphone on top. That's the privilege of the front row. And I can see your ball spot, but I'm the only one. Don't worry. Go ahead, Senator Furphy.
You're seeing the better side of me, Mr. Chairman.
I know the feeling, Senator. Go ahead.
Thank you. My question is regarding adults with development disabilities. I've been contacted by a couple of the ARC homes where those patients are taken care of. And I've been contacted by older adults who are saying, my child is in that facility. With these cuts, they may have to come out of the facility. And the adult said, I'm not in a position to take care of those disabled adults. I'm not exactly certain where that is in the budget other than the health department, but I'm very concerned that those cuts may have a very negative impact on those disabled adults. Thank you.
Thank you, Senator Furphy. How about if we do one more question from Senator Cost, and then we'll get back to you, Senator Kinski. Senator Cost.
Thank you, Mr. Chairman. And I realize all the cuts, excuse me, and they're needed. What I'm concerned with is how many of the cuts we're making are going to come back to be more expensive to us down the road because of what the implications are from those cuts now. That's my worry. Through Medicaid and the different programs we cut now, is that going to come back to haunt us in a few years? That would be my concern, or next year or the next year. So that would be my concern.
Thank you,
Thank
Senator Cost. Let's go ahead with Senator Kinski, and then we'll pick up some more questions.
Well, thank you, Mr. Chairman. First, with respect to the provider that may lay employees off and I didn't get all the numbers, but I'd have to get a little bit, if I can get a little bit more detail from you, I can circle back. But in all of these, I mean, you would expect for the providers to call their elected representatives and say that they can't weather the cuts. I mean, I don't know what else a provider would say. I was a healthcare provider. I lobbied my state senator and my legislator as well. So, I mean, much of this is to be expected. So what do we tell these folks? I guess I'd tell them we're facing $1 billion deficit in about 4 to 6 years. And that the cuts have to be made or taxes have to be raised substantially. And that, you know, the department's doing the best it can to pick the cuts as judicious as they can. And the governor signed off on these. But the other thing is, I think it's important that the department does monitor all of this data. I mean, they monitor wait lists. They monitor whether people are being turned away for care. They monitor whether people are dropping their Medicaid certification. They monitor whether providers maintain fiscal solvency. So they track participating providers monthly. They evaluate trend and geographic coverage. No large providers have closed their doors. The number, for instance, of residential service providers has actually increased to 206 in January 2021. And considering the number of providers for each waiver participant, Wyoming is consistently at or near the top. Now, this is specifically on the DD waiver, but they monitor these providers because they've got to know if they've overstepped, if they have to reconsider. So to my friend from the Basin's point, they are monitoring carefully to see whether these are going to end up actually costing more rather than less. They do track some financial indicators available in tax returns. The Form 990 is filed for all nonprofit providers to the IRS. And they can, there is a time lag, but they can monitor the solvency there. And then in the rare event that a provider is no longer able to continue functioning, they have a case manager transition. You'll recall that in the Southwest several years ago, there was I think it was a nursing home that closed, and they made sure that all those patients were transitioned somewhere else. So, so with respect to, I do understand the concern of a parent that has a child in a home for those with developmentally disabled, that either the home will close or that the home will discharge the client. And all I can tell you is that we're going to monitor it. You know, they are under Medicaid. They're supposed to take all comers. They're not supposed to pick and choose. Well, this one's going to be less expensive to serve than that one. They're supposed to take all comers. So regardless of the degree of impairment, as long as it fits within the scope of what they're able to provide, they should be able to continue to provide for them. So again, I mean, we're looking at, there was a tremendous run up in the reimbursement rates about 15 years ago, and now we're looking at a run down in them. And I don't know that we have a whole lot of choice unless we start raising taxes. I don't know that there's going to be a good time to have these cuts. I don't know that these cuts are going to be any easier a year from now. I don't know that we're going to have any more money than we have now a year from now. I honestly don't know. There are just not a whole lot of good choices. And I don't know where else they can get the money. It was important I take you through all those other aspects so you can see that every single program they have put through a sieve pretty carefully to try and extract what they can. And so, you know, we still have all the Medicaid nursing home benefits. We still have a huge program for Medicaid eligible beneficiaries. We spend a tremendous amount of money on healthcare, mental health, substance abuse in this state, and we'll continue to do so. But we have to make some cuts, and sadly, this is where we're making them. Stand for further questions, but I would like to get more detail on the case you talk about.
Thank you, Senator. Let's go to Senator Scott. And then we'll come over to Senator Schuler.
Mr. Chairman, and I'll have some further questions later, but I've got one in particular following up on the question from a minute ago on places where this reduction is going to cause us to spend a good deal more money down the road. And I am particularly concerned, as your education chairman, about the reduction in the preschool developmental disabilities programs. And want to inquire, was there any discussion of what the implications that had for spending on special education in schools, which we are reimbursing for? Mr. Chairman, it is much easier, cheaper, and easier to treat kids with developmental disabilities for many of the disabilities in the preschool DD programs than it is in special education for two reasons. One, developmentally, the younger you catch many of these conditions and get them treated, the easier it is at those early stages of the development of a child. There's a lot more plasticity, I guess is the right term. Maybe Senator Baldwin can correct me if I'm wrong. Sorry, but it's easier to treat them when they're young. I think that is well demonstrated. Second, our special education programs in our public school systems, because they've been on full reimbursement for so long, have developed some very expensive habits. And we are asking to see a big increase in those programs with that reduction in the schools. So I would be particularly interested in what discussion there was as to what the consequences for that reduction were going to be anywhere from, Mr. Chairman, 2 to 4 years down the road or longer as these children hit school age and need to make up for what they didn't yet at the child development centers. So.
Thank you, Senator Scott. Senator Schuler.
Thank you, Mr. Chairman. Yeah, a couple questions, actually. The first one on the Wyoming Home Services. I think you mentioned something about data that possibly the Department of Health had mentioned that it's a cost saving. They haven't seen a cost saving with that. And I'd like to see that data because I can't imagine that if we have folks that are able to stay in their homes with the small amount of money that is paid out for that versus, probably about $5,000 a month if they end up going into a nursing home. So I would really like to see that data because I just can't imagine that they've either not got an awful lot data or apparently I just can't believe it for right now. So I'd like to see that or know a little bit more about that. And then secondly, you mentioned something about the respite care program and I just didn't catch all of the information on that. And I didn't, and I'm not seeing it in my budget. So I just needed a little bit more clarification on that. Thank you.
Thank you, Senator Schuler. Should we do one more, Senator Hutchings, and then we'll go back to Senator Kinski.
Thank you, Mr. Chairman. Hopefully this question won't be too difficult to handle. I really appreciate the senator from Sheridan going over the budget reductions. It was a good presentation. My question is, what percentage of our entanglement in federal government programs such as Medicaid hinder our budget reduction request? Thank you, Mr. Chairman.
Thank you, Senator Hutchings. Senator Kinski, I see that you got a lifeline. Senator Perkins.
So I'll take this and I'll talk from just some broad points while Senator Kinski continues to marshal some of his thoughts. So first of all, going back to that last question first, most of, certainly not all, but many of the services have federal programs. And quite frankly, the FMAP, the federal matching money makes, in most instances, makes that much better. There's a lot more services to provide because you're doing that. And indeed, when you go back and look at these specifically, many of these, to cut the general fund, you not only cut, if you cut $3 million out of the general fund for that application, you're also giving or giving up or cutting an additional $3 million of federal funds because that's the total. So you cut 3 million, the net cut to the program is 6 million because there's a federal match. It does hamper it in a few places, particularly with early childhood education and things like that, because there are some programs that have what are called maintenance of efforts. And so for you to continue to get federal money, you have to continue to maintain a certain level of effort and there's some other strings that are attached as the good senator. There was a few of those that if in order to get the federal money, you have to continue to provide at least a minimum amount of benefit. In most of those instances, the federal money is at least equal, if not exceeding what the state pays. But it does make it a more interesting and more challenging effort when you cut, because like I said, in many instances, you cut one general fund dollar, you're really cutting two out of the program because the other one's a federal dollar. And that's the other thing. The other general comment I'd make before Senator Kinski gets up and talks, and goes back to my remarks earlier. I mean, these cuts don't help anybody. I've told you that 3 or 4 times now. Told you that again today. I'll say it again now. They don't help anybody. They cut. We're cutting services to the people of the state of Wyoming. Why are we doing that? Because we don't have the money. When it's like a 16-year-old coming in and they say, they're 15 and they're turning 16 next week, and they say, come in. I said, boy, Dad, I'd sure like their mom. I'd sure like a new car next week when I turn 16. And they said, we don't have the money for a new car. They said, well, it doesn't have to be a Corvette. It can just be a Volkswagen Golf. I guess I shouldn't be using proper names. And you say, I'm sorry, son or daughter, we don't have enough money for you to have a new car. And that's the issue you have before you is we have kicked this can down the road for a while. And it's getting close to where we can't kick it down the can anymore. This budget comes back and cuts the general fund back to where the general fund now looks like it has equilibrium going forward. But in those cuts, I want you to make, when we cut this budget of state government, I'm going to just make another point here, that when we cut state government, you have to understand that probably 2/3 of state government is not spent in Cheyenne. It's money that goes back out into your communities and is spent by your neighbors who are providing these services, whether they're doctors or case managers, or they're looking after adult DD individuals, or they're looking after children DD, or they're looking after veterans, or these are peoples in your community, and that's where this money goes. Let me give you I'll hit just a couple of points because they're illustrative of much of what happens in the Department of Health. I picked on the Department of Health Healthcare Financing Administration, and this monitors and oversees a lot of the healthcare financing that goes on out there. Out of a total budget of in healthcare finance of $81 million, which does a lot of things beside that. The grants and aid, the Series 600 for the grants and aid that go out are contractual services out of the state of just under $60 million. That's $60 million that's paid out of the state to your neighbors and the people in your communities that are employing people. And so when we cut, it's not cutting Cheyenne, it's cutting your neighbors. And so I would expect if you're not receiving calls from your neighbors and your friends who are talking about the effects these cuts will have, then they would be asleep at the switch. Another example is if you go to the Behavioral Health Administration, if we look at the contractuals, excuse me, that's not the one I look at. Look at the outpatient mental health out of a budget with after the governor's recommendation, but out of the original budget, total of $38 million for outpatient mental health. How much of that goes out into communities to the mental health care providers that work in your town? $38 million, 100% pass through. So as we cut these budgets back, do they hurt in your communities? You bet they do. But that's where we find ourselves. You don't think that cutting YDOT budgets don't affect the people who lay the private contractors who lay the sand and gravel and do the asphalt in your communities? Sure they do. But when you have 35% of all general fund dollars that we spend in the entire state go through this one department, As you come back and as you look at this, where else you can't cut where there's not money to cut. You have to cut where there's money. Doesn't you get to drill for oil someplace, there's no oil there. You have to drill for oil where there's oil. You have to cut where there's money. And so what did we do as we went about that? As you heard and as was tried to be explained on numerous occasions, the department monitors that. In many instances we cut because the cuts were made to certain programs because you could find relief under another program. We cut in some places, so you might be able to find Medicaid services to cover many of those, or they may be able to qualify for the S-chip program in some instances under mental health parity rules with respect to your insurance. They may be able to find it if you have your own healthcare insurance, you may be able to find some help there. The net effect of all this is the services are going to be cut. It's going to be a squeeze on the people who provide those services who are independent contractors and have businesses in your communities. It's going to squeeze them because the amount that's being paid for them are going to decrease. It's going to increase waiting lists significantly. And so we're going to let our good senator from Sheridan get back to some of the more specific answers to the question, but from just a high level of all that, this is no fun. These are tough choices. But when you come back and you say, well, let's restore that, let's do that because it's going to hurt a lot. My question to you would be then, where would you have us cut instead? Now, there's some limited ability to put some money back under the current forecasts. And I'm sure that there'll be some discussion about that. We'll have those discussions over the next few days. But to go back and put back in the tens and tens of millions of dollars that have been cut, the money's not there. I mean, as we went before, there's $447 million of general fund basically general fund cuts that are included in this package. And so if we don't cut there, where do we cut? Where do we do it? And so I just asked that question. Thank you, Mr. Chairman.
Thank you, Senator Perkins. Let's hear from Senator Landon. We're still warming up Senator Kinski back there.
Mr. Chairman, thank you. I realize we're spending some time on this section, but it is, as the good chairman pointed out, a huge portion of our budget. It strikes me as pretty tough when many of these things here target the least among us. And that's what is really hard to swallow, but I totally get it. I do have this concern and a question for the senator from Sheridan County. As we have taken every bit of slack out of this budget, and we have taken slack out of other administrative agency budgets, I wonder if we get in trouble these next few months, if we have the ability to bail out a facility, as we had to do a few years ago, up in my neck of the woods, as we limit the payments, limit the Medicaid reimbursements and all of these things. We heard from the senator from Albany County how that facility over in his neck of the woods is really concerned about being able to keep the doors open. I just wonder if, do we have anywhere that we can transfer to anywhere and an ability to, or are we going to end up back down here in a special session? And with that said, was there any conversation given to, can we set aside maybe a disaster fund on behalf of some of these healthcare line items in case we do get in trouble? Thank you, Mr. Chairman.
Thank you, Senator. Senator Kinski, before we get too many questions ahead of you, how about if we go to you?
Thank you, Mr. Chairman. I wanted to follow up a little bit on the comments made by my chairman. And it's a couple people have asked, what discussion did you have? What discussion did you have? Appropriations Committee, we just pretty well marched through one heck of a lot of cuts to one heck of a lot of agencies. And it got numbing after a while. The cuts in this department, I was surprised that they could even be brought to the table. And so before the current DOH director, there was an earlier director under an earlier governor who was a very accomplished executive. He had run the city of Casper for 27 years. And under the prior governor, there was a downturn and this budget had been raked through and cut. And then there was another couple years later, there was another round, and then there was another round. I mean, this budget had been gone over and over and over. I thought it was down to the irreducible minimum. Who thought there was anything else to cut? Well, now we know why, because the only cuts left are even more painful than every cut that's ever come before. And so that's kind of where we are. So of these cuts, this department's budget is started out as 1.992 million. 1,992 million. If these cuts are adopted, the department's budget will be 1,848 million. It's still a huge budget. I mean, there's a lot of money going out for behavioral health and immunization and healthcare and nursing homes. This cut in total is 144 million, but 112 million of it is general funds. So part of what they were trying to do is by the time you work around all the federal restrictions on what you can't cut and you have to provide, and with your highest priority to save general fund dollars, they managed to come up and save $112 million out of the $144 million in cuts. And it's extraordinary and painful. So with respect, first, my friend from Bates Creek, the reductions on the early identification, early intervention, what discussion did we have? We didn't spend a lot of time on it, frankly. I mean, it's just, we did not spend a lot of time on it, frankly. It's just, it's a cut that had to be made. And the hope is that these providers take this cut and that, 2 years from now, they'll find a way to adjust. Like we all have to adjust budgets. They find a way to do with less, to operate more efficiently than they have, and to continue to identify children and provide appropriate interventions. And it breaks my heart. I was on the board of a child development center. I have people in my family whose lives were saved by early identification. You know, if you know at the age 2 they've got dyslexia, rather than by the time they hit 4th grade, you can have a huge impact. But the hope is the providers will absorb the cuts and continue to do what they do. To my friend from the southwest corner of the state, you'd like to see the data. I think what I said is the department can't prove that it's saving. They can't prove that it's not saving. They said not being able to prove that it's saving money is not the same as saying it's not. They can't prove it. They just don't have that data. In some programs, you can say, here we did this, and over here we're spending less money. They can't say that. They cannot say that. Now, again, I would emphasize, this program is for the non-Medicaid population. So we're spending to keep non-Medicaid patients out of the nursing home. That's a laudable goal. The question is, if they've got resources, would they still stay out of the nursing home? Would they still go out and get those services without this subsidy? I don't know the answer to that. I know in the case of my mother-in-law, we provided service to her from our pockets as long as we could. I think we had help from the senior center and try and keep her out of there. Eventually you hit, depending on your situation, the amount of money you have, you hit what's called spend down. And so that's when you've exhausted all your resources, you have no money left, and now you're Medicaid eligible. And so how that interplays with this non-Medicaid population, I don't know, and I don't think the department knows. And my inbox is stuffed with people who really want this program to stay. And the appeals are heartbreaking, as though somehow I have the ability to make our situation different than it is. And when I go home, I'm going to have to face all those folks. And I will tell them, we had to make those reductions somewhere. And then to my colleague from the center of the state, the question about once you cut all the slack, can we bail out a facility? That's a good one. Let me circle back to the department, see what I can find out. How would they respond in the event of a failure, given that we've cut into cut into programs that even 4 years ago, you wouldn't have thought of doing the kind of cuts that we're having to undertake now. Thank you, Mr. Chairman.
Sorry, my mic's not on. I see somebody over here that wanted to rise. Okay, Senator Scott, back to you.
Mr. Chairman, I've got a separate question, got a couple of them actually. But I would comment on the preschool developmental disability programs. There've been a series of cuts there. It is my judgment that at this point, what you're going to do is see actual reductions in services that are going to impact the ability to get these kids cured or brought along as far as they can. And I think we're going to pay for this cut multiple times over in higher special education expenses in the next few years. And Mr. Chairman, I think that's foolish. I think that's one we better revisit. Now, next question I have was, it was mentioned that there was some reduction in the program that provides colonoscopies. And the question I have on that is, why didn't you cut that program all the way out and cut out the people that are administering it too? The problem with that program, and I know something about that program because it was my legislation that created it. It was designed because the colonoscopy, it does cost us money. It saves some money by preventing colon cancer. And it's a very cost-effective way to save some lives and prevent that particular disease. But it has never been properly marketed. They've not been aggressive at all about the program. What's happened is a few people that are really in the know have found out about it and gotten created that way. And since the program was enacted, the federal government has changed the healthcare system quite a bit. And a lot of the potential customers have been able to get the colonoscopies without coming to that particular program. And I think the current one, the way it's, and I'm not totally current in how they're handling it, but I have a strong suspicion that there's a fair amount of injustice done. You have to be in the know to get in on the program. And frankly, I think rather than just reducing it and reducing all these other things, that would be a good one to get rid of. So the question is why didn't you? And then, Mr. Chairman, I'll have another question.
Thank you, Senator. Let's go to Senator Dockstader.
Thank
then
you.
Senator Baldwin.
Mr. Chairman, I keep hearing these references. If we don't do it now, it'll cost us more money down the road. And I'm trying to track that. Do we know exactly how much more it's going to cost us down the road if we don't take care of it right now? And I don't know if this committee knows the answer to that. I don't know if our good senator from over Bates Creek knows the answer to that. I don't know, but I keep hearing that reference and that warning out there that if we don't take care of it now, we're going to be spending more money down the road. I would like to know just how much more that we're going to be charged, or what kind of expense we can expect down the road with that. And for those just coming into the Senate, inboxes are full. I wish it was just inboxes. My phone's ringing. My texts are going off right now while this conversation is going on. We have touched the point where we're reaching into those who we need to care most about, but we don't have the answer because we are simply out of money. It's not just our problem, it's our responsibility, but everybody across the state now realizes the position we're in.
Thank you, Senator. Senator Baldwin, shall we get you?
Sure. Thank you, Mr. Chairman. I'm just sitting here, a lot of this is comment as much as it's questions. As we were sitting here going through this budget, I wanted to say, ouch, after each little piece, but because it cuts deep. And to answer one of the good president's questions that he just asked about cost, I would subject to you that one of the costs is that Wyoming is back at #1 in suicides now. And that's a big deal. And that's part of our mental health programs, and it's part of what we're cutting. And I think that's a really big deal, and I think we need to address that. And I completely understand appropriations. I feel for them. I appreciate them. You guys are a lot tougher than I am. But as far as cost, I'm thinking about things specifically like developmental disabilities, care for the elderly, the things we do to try to keep them out of the hospital, keep them out of the nursing homes. And I think that's some of the costs that we're talking about. When those caregivers can't do any more in their homes, they can't take as many people because they had to cut staff. Where do those developmentally disabled kids go? Or adults, not necessarily kids. Where do they go? In the end, is that not going to cost us as a society? Are they going to end up at one of the mental health facilities, which are already over full? When mom and dad or grandma and grandpa can't stay at home because those elderly services aren't available anymore, are they going to go to the nursing homes? Are we going to end up with nursing homes with problems like we did a couple of years ago? Sitting here thinking through this, I can't help but think a few years ago, I don't know, 2 or 3 years ago, maybe the other senators would remember when we made significant cuts and we ended up cutting too deeply. And we had to go back to the Department of Health and put some of that money back. I have to wonder if we're not there again, and if we don't have the money you put back, what are we going to do? I think the short senator from Natrona County hit on a key point. What are we going to do? And the final point that I would make that came to my mind is when one of the previous Department of Health leaders, the last one with our last governor came in when we did this last round of cuts. Maybe the former chairman of our committee would remember when he came in, when they first started making those cuts, I don't know that he wasn't nearly in tears. It was painful to him. It was painful to everybody on the committee. For those of you that might have been on the committee at that time, it was a big deal. And we really haven't, other than putting back a little bit when we cut too deep, we're really not going further. We're dropping further off. I don't know that the new Department of Health is going to break into tears, but I can tell you it's awful tough on the committee. And it's tough on our families and on those people in homes, the elderly, all those people that are out there that depend on these services. And I wonder, like good senator from Natrona County, what will we do if we cut too far this time? What will we do to replace that? We can't fix those lives. So what will we do? I guess that's the question I would have. Thank you.
Thank you, Senator Baldwin. I see somebody over there, Senator Guru.
Yes, thank you, Mr. Chairman. Just a comment, back to my friend from Bates Creek too. For each time, I can assure each one in the body, this was excruciating for all of us. And each time we ask ourselves a question, what would be the cost of cutting this program? What would be the cost of cutting it? What would be the cost down the road if we did? For each time we decided to do one, it was because there were 3 other programs where the costs were higher if we cut. And so we decided it was triage 101. And and that's what over the next few days is probably will decide how well we did and what we need to change. And as a senator from Bates Creek said, maybe we missed the mark with colonoscopies. I don't know. I won't even touch that one, but I will say that.
You just did, Senator.
I guess it did. But I will say that those were the choices we were making. Those were the choices. And we thought about it. We thought about it a lot as we went through. And even for groups that don't have a big constituency here, that don't have people you're not hearing from. You're not hearing from folks at the prison who we talked about trying to keep some programs for them for substance abuse. They don't have representation, but we know the recidivism rate if we don't fund it, and we know what that costs. And so those were discussed. And so as we went back and forth on all these programs, believe me, we argued and hashed out a lot of this, a lot more than you'll ever know. And we look forward to your help as we move forward. Thank you.
Thank you very much. Whoa. Well, let's go to Senator Hicks and then we'll pick up the rest of you guys.
Mr. Chairman, ladies and gentlemen, welcome to the Wyoming Senate. This is just round 1, folks. Just round 1. So here's the discussion. Every one of these touches somebody right now. So how do you solve this problem? Well, you've all seen the taxing capacity of Wyoming. 1% sales tax, income tax, property taxes, corporate taxes. So this is just round 1, folks. This is the start of a tough discussion. Some of us might be here for 2 years, some of you for 4. But you better get ready, folks. better get ready. Because until you're willing to go out and substantially raise taxes, you know, we're getting this thing right now. You're getting emails, just, you know, 1 penny for the kids, right? Just 1 penny. Well, that doesn't solve the K through 12 education project. It's 2 years, then it's another penny, and then 3 years, it's another penny, and 6 years, you're at 10 or 12 cents sales tax. You got a lot of tough decisions to make. Welcome to the Wyoming Senate, folks. That's where we're at. And so, yeah, every single one of these is going to be darn tough. Everybody's going to have to step up to the plate. Everybody is going to have to step up to the plate. It's a 12% reduction in the agency's budget. Yeah, and it hits some pretty hard places. Is that 12% equitable with other places? Probably not. You know, I look at this and we talk about the tough decisions that we're making. We're second guessing everything that the guy that had to make the tough decision sits downstairs. You want to know who the fiscal conservative is in Wyoming? He's downstairs, folks. We went in as a JAC and said our goal was to cut another $100 million out of it. We couldn't do it. We got another 10 or 15 million out of the governor's budget. Now you've been asked to make a decision. And we're going to have this debate. And there's going to be areas that we think the governor's wrong. The JAC already went in here. We restored another $600,000 back into this program, and a little bit here and a little bit there, tried to address the concerns. We don't have any more crystal ball or clairvoyant than anybody else in here. So when you ask the question, what's the impact? The question is we're going to find out, folks, what the right size of government is in the state of Wyoming. We also need to ask ourselves, and this gets to, I think, my colleague here from the southwest corner of the state. This is a hard discussion. And the hard discussion is what's going to happen to the rest of our communities? Are you going to step up and volunteer to do a little more in your community? It's each one of you. What's the role of the church? Is the church supposed to step up and take on some of these responsibilities? What's the responsibility of your family? The senator to my left has indicated. Some of these programs we already pay, and we pay, and we pay, but if they're not there, somebody is going to take that money out to their Medicaid eligible. It's not fun, but you got 4 more years of it ahead of you. This is just the start, folks. Round 1 and a long thing. Unless there's some grandiose thing happens and we see the minerals start flowing out of the Wyoming, which is highly unlikely, you're faced not only with reducing services, you're going to go back and say, we're going to increase taxes. Every time you think about that, it's a balance. Think about what you can do, what your community can do, what your family can do. I always hearken back to the John F. Kennedy speech. Ask not what your country should ask for you. What can you do for your country? And maybe, folks, it's time that we start asking ourselves that question and go back to your community and ask the same thing. What can the community do? What can the church can do? What can the family do? What can your neighbors do? Because we're at that point. It's only going to get tougher from here on out.
Thank you, Senator. Let's start from folks that haven't talked yet. So Senator Rothfuss, we'll start with you. And
you,
we'll get
Mr. Chairman.
Senator Anderson next.
Thank you, Mr. Chairman. I wanted to pile on to the doom and gloom we just heard from the good senator from Carbon County, because there's one other component that really hasn't been raised, and I wanted to ask if it had been discussed. And that is the economic impact, the economic implications for the state of Wyoming of effectively withdrawing $150 million of funds from the healthcare economy in the state, which is what we would see here. And I think most of these funds, particularly the cuts, are cuts for services, and many of them are federally matched. So we know we're drawing in additional external funds. And so I would like to know if there was discussion about how many projected jobs lost. This would represent not just the ones in the department, that's obviously on the FTE list, but when we project a $150 million hit to our healthcare sector in the state, how many jobs is that anticipated to reduce? And what are the follow-on, the carry-on economic implications of an economic cut of this magnitude, which is obviously not, it's not just a few $100,000 that we're adjusting the economy by. This is significant in terms of the implications to the economy. And I contemplate the fact that this 1 year cut, and I agree with the good senator, this is probably the first if things don't change. Nothing on the horizon. There's no great schemes ahead and no light at the end of the tunnel based on our current projected policies. So if this is the first step, it seems as if this is probably greater than the sum total of all economic development we've added in terms of value for the time that I've been in the legislature, just to the Department of Health in this one cut. So was that discussed? Was there any analysis done? Did the department provide any details, or perhaps our business council provide any projections on the follow-on economic impacts and damage to the state's economy that would be done by a cut of this magnitude? Thank you, Mr. Chairman.
Thank you, Senator Roth. With Senator Anderson.
Thank you, Mr. Chairman. That was a great segue to what I was going to say. These cuts hit the larger communities disproportionately because the larger communities in this state have offered those services that we're talking about cutting. And every cut we're talking about, I had a organization in my city that furnishes that. So I think disproportionately, it's going to hit the larger communities and maybe not the smaller communities, because some of them didn't furnish those services and the larger communities furnish the service for them. If I go to some of our organizations, I meet people from Sheridan, from Sundance, from Gillette, from various places, and they not necessarily are all Natrona County people. So I think that'd be an interesting economic analysis as to where that's going to hit us, because it's going to hit us in our big cities and our health workers in our big cities far more than it's going to hit the little communities. So I'm interested in that economic analysis also as to where it's going to hit. Thank you.
Thank you, Senator Anderson. Who's next? Who's next? Senator Costa.
Thank you, Mr. Chairman. You know, this weekend, I wrote on my Senate Facebook page and asked constituents, I said, how many of you in the last 5, the last 10, the last 15 years have had a raise? And for those raises, are you the one sending me an email that says, keep the budget, balance government, do like the rest of us and balance the budget? I said, the problem is you're asking the government to balance the budget with what happened as far as, if we go clear back, 1937 with the beer tax, as well as some others. And at the same time, you're balancing your budget in the present. It's not equal. You like all these things, but you want us to find a way to balance our budget. Well, I'll tell you what, these good people in appropriations are balancing that budget. And it's going to be tough. And if we don't realize that there's two sides to this and that we've got to meet both of those sides, and we can't say government is a bunch of crooks and government's the ones that are ripping us off, and we can still cut the government, we're fooling ourselves. We have to help contribute to that. And I'm not a fan of reducing the amount of income I have any more than anybody else. But I'll tell you what, if we don't put our part in, we can't expect that other part to come out. And so I applaud these guys for it. It is a tough decision. And we've all got to make that. And we're going to stand and make it again when education walks in here too. And there's going to be a lot of people that aren't going to be very happy. But you know what? You can only do what you can do. And if we don't have the money, there's gonna be a lot of people out there screaming at you. And if you try to dodge it, I don't know that I'll have much respect for you, because we got to face both sides of that. So I support them in the effort they've done. And I think it's important that we understand we can question all of it, but we can't undo what's already there. And that's it. We don't have the money to do it. So I just think it's important we all look at that as well, because it's easy to point at the other side and say, well, what about this or what about that? But in the end, it doesn't answer the question of balancing that budget with what we have right now. Thank you.
Thank you, Senator Cost. Senator Cooper?
Thank you, Mr. Chairman. I was home this weekend. I had a pretty long conversation with my dog. He's a border collie, pretty smart dog. He's a good listener.
It's not like any border collie I ever had.
Well, he's a little hard of hearing, but he's a good listener.
Go ahead, Senator.
He put in front of me a word, his word of the week was conundrum. And that's where we're at. A conundrum is a difficult or puzzling question with no obvious answer. And I think that's exactly where we're at. Some conundrums are a little more easily solved. For example, is Lost Springs a suburb of Orem, or is Orem a suburb of Lost Springs? You know, we can figure that out. Somebody in this room knows. But when I look around this room, I see such a wealth of intelligence. It's just mind-boggling to me, the amount of experience and intelligence we have in here. And to get to the answer of any question, what we got to do is take the question apart piece by piece and then answer the individual pieces of it. And then we come up with a logical answer. That's what these good people on the appropriations have already done. They put literally thousands of hours in on it. Is it perfect? Probably not. But at this point, I got to trust their judgment, and I've got to go with what they're telling us is this is where we're at right now. If you got a better answer, we're willing to listen. But if we're just throwing questions without coming up with solutions, we're not doing any good here. So I'd like to thank those folks and try to be part of the solution rather than more of the question.
Thank you, Senator Cooper. I sense we're getting close. Let's hear from people that haven't spoken yet. Senator Culp. I could get you lit up.
Thank you, Mr. Chair. I'd just like to say that I did spend some time dealing with budget issues. There were about 3 decimal places different, though, more zeros. But the fact is, it's going to get worse. The fact is, it's not getting better in the foreseeable future in order to avoid this. I look at this as a step down in our expenditures. It's a step. It's the first step we have to take to get where we need to be as, from my point of view, being responsible for this budget because of what I know. Even though I haven't been here a long time, I can see the handwriting on the wall. And the committee's done good work. Is it perfect? Obviously not. Is it something we have to do? Yes, it is. So I'd just like to stand in support of the work that was done and the reasons why it was done. Realizing, yes, it's going to be painful, but we're in the beginning of a trip. And I think we just have to realize that and make the best of it and make adjustments when we need to. Thank you, Mr. Chairman.
Thank you, Senator Culp. I'm sensing we're getting towards the end here, so let's hear folks that, and you're all going to talk again when we have amendments, just remember that. But Senator McEwen, we'll get you and try to get folks that haven't had a chance.
Thank you, Mr. Chairman. I also am in great support of the Appropriations Committee. I like what they've done. I just wanted to point one thing out. We can't tax ourselves into prosperity. It's all going to be a zero-sum game. If we lose $100 million of services in those jobs, that also leaves another $100 million in the economy that we're not collecting as taxes to pay for those services. So I would just caution people to think as we do the cuts, we're actually putting money back into the economy. Or at the very least, it's a zero-sum game. We're just trading who controls the purse strings on it. Thank you, Mr. Chairman.
Thank you, Senator. Hey, how about if we get somebody from the Appropriations Committee to bring us home? Senator Rothfuss, I'm gonna let you go before that, and I see Senator Scott, he'd mentioned earlier, so I'm trying to get there, but we'll go to Senator Rothfuss and Senator Scott, and then maybe the Appropriations Committee could bring us in. Senator Rothfuss.
Thank you, Mr. Chairman. I did just want to point out one more point that doesn't seem to have been addressed. And that is the concept that we are empowered to solve this problem in a number of ways. There's been a lot of discussion of we have no choice, that there's nothing else we can do. We have to go with the Appropriations Committee's recommendations, which they did work hard on. There's no question. And they made cuts because they had to make cuts because that was the directive they were given. They're not the Revenue Committee, they're the Appropriations Committee. And they had challenges in front of them, and they took on their responsibilities. But we're the legislature, and we are fully empowered to solve this problem through either a mix of new revenue and cuts or new revenue. We can do that. We're the only ones that can do that. Obviously, and regrettably, we can't start bills over here. But there's no question, because these numbers have been run, the calculations have been made. The Revenue Committee has explored just about every option that's out there. There was a recent study that was put forward by one of our community colleges, in fact, that did an excellent job, an exceptional analysis, comparing our state's revenue structure with our colleague states' revenue structures, those that have minerals, those that don't have minerals, those in our neighborhood, those that aren't, and adopted a series of different revenue structures where they just said, well, let's take the state to the south. What if we had their revenue structure? Let's take the state to the north. What if we had theirs? They seem to have good economies. Some states to the west that are doing quite well. What if we took their revenue structure? Each of those states' revenue structures as alternatives effectively solved our revenue shortfall. Because the reality is, those of us not in coal, oil, gas, or other mineral extractive industries are just flat out not paying our fair share, and we haven't for decades. We're benefiting from these industries that have worked hard, have provided us with an incredible resource base and tax revenue base that has funded education, funded Department of Health, funded everything else, while the rest of us got to take it easy and not pay any taxes, Mr. Chairman. I've enjoyed the heck out of it. It's great. For my corporate revenue, for my consulting company, I pay just about nothing to the state. Just about nothing. I don't even know how I could pay more. If I tried to hand someone a check, they would refuse it. There's no statutes that would allow anyone to take the money that I would like to pay them. I'm willing to. We know that just a rampant increase in taxation to the point where one of the highest taxed states in the country would cripple our economy. We all understand that. What we're struggling to understand is that we have the lowest taxation in the country, and nobody seems to want to come here and play with us in our sandbox where we want economic diversification, but nobody's taking us up on the offer. Because they see that when austerity is the approach, as some states have done to the east of us, that you don't end up with positive outcomes. So as we lament the challenges and the cuts and the harms and the damages that we're doing to our communities and to the people back home, the pain that we're causing through these cuts, we have to realize that we have to make these cuts because we didn't provide for additional revenue when we had the opportunity, and because today, perhaps, we're not going to take on that responsibility once again. But again, it's not too late. I know firsthand there are plenty of bills out there that could lead to significant additional revenue if we had the political will to embrace those right now. And the pain of these cuts would be significantly diminished. And the pain back home would be remedied. But we have to have the political will. So it's a little bit disingenuous for us to sit here and say there's nothing we can do about it. We're literally the only people in the state that can. 30 here, 60 there, end of list. Nobody else can get it done. Thank you, Mr. Chairman.
Thank you, Senator. Senator Scott.
Mr. Chairman, got 2 points to make. One specifically on this budget. I thought way back when the presentation started, that I heard a 2.5% across the board cut Medicaid providers and then another 2.5% cut, which my simple math adds to 5%. I would caution us that we're playing with fire. In the past, we have not done, Mr. Chairman, across the board cuts in the Medicaid program. And one of the reasons is you've got quite a mix of providers. Some of them, Medicaid is essentially a byproduct in their product mix. It's a small part, relatively small part of the total business they do. Yeah, they ain't gonna like 5%. You won't kill them. But we've got providers in a number of areas that are dependent on Medicaid. In the nursing homes, we're almost 2/3, sometimes more than 2/3 of the total work they do is Medicaid. You've got to be very careful cutting those. They've got some minimum standards they have got to meet. And you don't want to change those minimum standards. You couldn't, but you don't want to. They're essential. You lose a nursing home, what happens? Big blow to your local economy. You've got a whole bunch of residents you got to place somewhere else, might well be out of the economy, take them away from family, out of the county. You got to think about what you're going to do if that happens. You've got in the adult DD area where they're taking care of profoundly disabled people, the residential programs, who cannot live without very expensive care. And Mr. Chairman, I know you know firsthand from some of the volunteer work, good work you've done, as to how severe some of those people can be. The misfortune that they had to be born the way they are. It's not their fault. We had a very close call a few years ago on those people. They're 80 to 90% Medicaid dependent. You lose one of those, we do not have the capacity in Landon to take their population. They cannot live on their own. The first thing that would happen would be after the payroll is missed, would be a call to 911 to take them to the local hospital. And that would be very expensive. We don't have the capacity. You'd have to send them out of state quite rapidly, and you wouldn't have any choice. So I raise a real concern there. The second thing I asked the Senate to think about the debate we've just had. We're making some very tough cuts. And my compliments to the Appropriations Committee to have the courage to look at it, to take a lot of heat, and they've taken their share already, and we're going to take ours if we back them the way we should. We may have to modify some of the things, we maybe can improve things. That's the legislative process. I hope it will work. But I asked the Senate to remember this discussion. This is the second largest portion of the overall spending, state of Wyoming. We'll be later this week, I hope later this week, discussing what to do about the largest spending item we have, which has a constitutional mandate to be efficient, which has been ignored. And when we get to that debate, I ask you to remember this one. We have a responsibility across the whole board, and it'd be very difficult to support this and let the other one go, because we are doing so much harm. And it is real harm to the things that we just have to do in order to keep our society safe.
Thank you, Senator. I think we're getting close to the end. I think we're ready for closure. Senator Kinski, do you want to address the Senate one more time?
There were a couple of questions that I wanted to be able to circle back to. First, with respect to my friend from the center of the state, when you talked about cutting out all the slack, will we still be able to bail out a facility? In last year's budget, we had a section 300 series, 305, which provides the Department of Health, UW, and the Department of Corrections with full exceptions to the 10% flex limitation. So they do have super flex authority. That does raise the question, though, if they don't have money to flex in. So I will circle back to the department on that, but I remind that they do have that. And then the other thing is, we will be back here in less than 1 year. I know that's not good news, but it's true. We will be back here in less than 1 year. So if we are wide of the mark, we can certainly come back and address that. To my friend from Bates Creek, I will talk to the department about the colonoscopies program, and why not just cut that out entirely? That's a good question. And then my friend from Bates Creek did ask again about an across the board 5% to all providers. The department's narrative did say that it's not 5% to every. Some would be more, some would be less. And so I will, though, follow up with them in terms of get a few more particulars on how they selected who got less and who got more. And then just there was a broad ranging philosophical discussion. And I do want to share with folks just really one of the most terribly sad parts as I worked on this agency that was mine to carry. And I rolled into joint appropriations from recalibration, from K-12 recalibration, where I heard we cannot do with less. And in fact, we must have more. And when I looked at these cuts, $112 million out of the general fund to all of these helpless people, I could not help but reflect when we left here last March, K-12 received an increase of $132 million because of all the escalators built into the model. In the ideal world, what would you have done? I heard the Senate president give a talk to a group where he said, I think they were moving a refrigerator or something, a large box, and everybody's going, you got this, you got your part, you got your part, you got your part, because we can't do this if everybody doesn't have their part. And his point was, everybody has to have a part of this, including K-12. And the fact that we had just handed out a $132 million increase that we are told we are constitutionally obligated to do and that we have no choice. In the ideal world, you would sit down and say, do we really need to cut these people $112 million, or could we just roll back some portion of that increase we just gave to K-12? Could they get by for a year or two without that extra $132 million? Would that be the end of things? Or could they find a way to get by? And because of the way we are with these court decisions and so forth, it just, everybody's not at the table. And ultimately, we've just got to find an answer to that, because we are going to be left with cutting these kinds of programs until we can get everybody to the table. Thank you, Mr. Chairman.
Thank you, Senator. Sensing that we're ready to closure. Absent objection, section 48 is closed. How about a 10-minute break? Mr. Majority Floor Leader.
Was that 46 or 48 closed?
48.
Thank you.
How about a break? I called on the majority floor leader first. Let's see what he has to say. Go ahead.
Mr. Chairman, I move the committee of the whole rise and report in respect to action taken today in committee of the whole on budget bill Senate file 0001.
That's a great motion, Mr. Majority Leader. You've heard the motion. All those in favor say aye.
Aye.
Opposed, no. The motion is carried.
James Bond by that week. Here's a budget bill 7.
Mr. President, you gotta come back. But I think he wants us to report on this one. Do you want to do the report now?
Yes.
So you need to take the chair, Mr. President. Thank you.
Please read the report for Action Day on Committee of the Whole, Senate File 1.
Mr. President, with respect to the budget bill, Senate File 1, the Committee of the Whole heard explanations as follows. Section 001 closed, Section 002 closed, Section 003 closed, Section 004 closed, Section 006 closed, Section 007 closed, Section 008 closed, Section 009 closed, Section 010 closed, Section 11 closed, Section 15 closed, Section 20 closed, Section 21 closed, Section 24 closed, Section 27 closed, Section 32 closed, Section 37 closed, Section 39 closed, Section 41 closed, Section 42 closed, Section 44 closed, Section 48 closed. Senator Case, Chairman.
Senator Case.
Mr. President, I would move for approval of the Committee of the Whole report with respect to actions taken on Senate File 1 today, period.
You've heard the motion. All in favor, say aye.
Aye.
Those opposed? Aye. Motion is passed.
Could we get a 10-minute break or so?
Really quick, though, we're going to defer to Senator Guru.
Okay.
Senator Guru.
Thank you, Mr. President. Before we go on break, I just wanted to make an introduction. A friend of mine who came down to visit, and a friend to all of you as well. I'd like to introduce the chairman of the Teton County Commission, Natalia Duncan-Macker.
Thank you and welcome to the Senate, Madam Chair. Thank you. Okay. Senator Perkins.
I have privilege of the floor for just one
Please do.
moment.
Granted.
Thank you, Mr. President. Also, just to remind you that we'll continue on with the explanation of the budget tomorrow, but the second reading amendments to the budget have to be in to LSO. The request for those amendments have to be in by 5 o'clock tomorrow. So if you've got amendments that are percolating around in those fertile minds of yours, you know, you can go now, you can go later, but you got to go before 5 o'clock tomorrow. So thank you.
And there might be a couple amendments. Okay. All right, let's do this. The Senate will stand at ease until the sound of the gavel. And just a quick reminder, those of you who ordered chocolate dump trucks, they're available back in the dining room, okay? And if you don't know what that is, then don't worry about it. Okay, at ease until the sound of the gavel. Senate will come back to order. Before we go to you, Mr. Floor Leader, for the record, in accordance with Joint Rule 14-1B, further committee of the whole action will be continued until the next legislative day, Tuesday, March 9th, 2021. Mr. Majority Floor Leader. For the motion, all in favor, say aye. Opposed, nay. Yeah, Mr. Floor Leader. Keep that in mind. Senator Case, return. I'm not sure you're back by popular demand, but please come back.
Okay. Do you guys hand bills up or how do you do it different now? Oh, okay. They're in a different color folder. We're changing everything. Committee of the whole will come back to order. The first bill for our, or file for our consideration is Senate File 108, Career and Technical Education Terminology. The reading clerk will please read the file.
Senate File 108, Career and Technical Education Terminology, sponsored by Senator Cooper, an act relating to education. It was referred to committee number 4, which returned to committee recommendation that it do pass. Ayes Senators Beitman, Ellis, Rothfuss, Salazar, and Scott. Senator Scott, Chairman.
You've heard the reading of the file. What is your pleasure, Senator Scott?
Mr. Chairman, I move in the committee of the whole rise and report it do so with the recommendation that Senate File 108 do pass. I think there was no standing committee amendment, if my memory is correct. And I yield to Senator Cooper for an explanation of this good little Senate file.
Thank you very much, Senator Scott. Senator Cooper.
Thank you, Mr. Chairman. Thank you, Mr. Scott. Mr. Chairman. This is Senate File 108. It's an act relating to education. It's changing the terminology from vocational education to career and technical education. This bill was brought to us by a high school student from Shoshone, Wyoming. He's asking us to bring our terminology into the 21st century. And that's what this bill does. All it does all the way through there is any place that says vocational education, it changes it to career and technical education. Now, that's a pretty simple thing to say. The reason why we need to do that, there's a difference between vocational education and career and technical education. And it's been explained to me as in vocational education, we used to build a birdhouse. Now we build the whole house. And that's the difference. So we want to bring our terminology into the 21st century, to name it correctly, to the type of education we're providing to these young adults. It's a pretty exceptional program, and we need to address it as such. Thank you.
Thank you, Senator Cooper. Questions for Senator Cooper? Not seeing any questions. The question is on Senator Scott's motion that when the committee of the whole rises to report that it do so with a do pass recommendation on Senate File 108. All those in favor say aye. Aye. Opposed, no. Senate File 108 is passed committee of the whole. The next file for our consideration is Senate File 109, Board of Dental Examiners Amendments. The reading clerk will please read the file.
Senate File 109, Board of Dental Examiners Amendments, sponsored by Senator Cooper, an act relating to dentists and dental hygienists. Was referred to committee number 10, which returned to committee recommendation that it do pass. Ayes Senators Baldwin, Bouchard, Furphy, Hutchings, and McEwen. Senator Baldwin, Chairman.
For the reading of the file, what is your pleasure, Senator Baldwin?
Thank you, Mr. Chairman. I move that when the committee of the whole rises to report it, do so with the recommendation that Senate File 109 do pass. And for explanation by return engagement, I give you Senator Cooper.
It's Senator Cooper Day at the legislature. Senator Cooper.
Thank you, Mr. Chairman. At the risk of sounding like a broken record, the only reason we're doing this is to bring our dental regulations up into the 21st century. Again, our dental examination language was very old, and what this does at this point is bring it up to to meet the national standards for the American Dental Association. There's no change to policy. A couple little things. Their examination is due every 2 years instead of once a year. That's to fit, again, the national standards. Licensing has to be renewed within 90 days of the date that the license expired, rather than 90 days from the end of the year that it expired in. But again, other than that, all the way through there, all it does is update the policies to national standards. And with that said, that's the whole bill.
Thank you, Senator Cooper. Senator Baldwin.
Just a quick clarification, Mr. Chairman, is that 2-year certification, part of the reason for that move was the opioid education that we passed last year or the year before. Every 2 years, they have to have the 3 continuing medical educations. This made it conform and made it easier for them to conform to that, going to every 2 years. So that was part of the reason.
Thank you very much, Senator Baldwin. Further discussion, any questions? Seeing none, are you ready for the question? The question is on Senator Baldwin's motion that when the committee of the whole rises to report, it do so with a due pass recommendation on Senate File 109. All those in favor say aye. Aye. Opposed, no. Senate File 109 is passed committee of the whole. The next file for our consideration is Senate File 2. Would the reading clerk please read the file?
Senate File 2, School Facilities Project Prioritization, sponsored by the School Facilities Committee, an act relating to K-12 school facilities. It was referred to committee number 4, which returned to committee recommendation that it do pass amended. Ayes, Senators Beitman, Ellis, Rothfuss, Salazar, and Scott. Senator Scott, Chairman.
You've heard the reading of the file. What is your pleasure, Senator Scott?
Mr. Chairman, I move that when the committee of the whole rise and report, it do so with the recommendation that Senate File 2 do pass. There was a standing committee amendment. I ask it be read in at this time.
Senate File 2, Standing Committee Amendment number 1, page 14, line 10, after.
Senator Scott.
Mr. Chairman, I move adoption of the standing committee amendment. Mr. Chairman, a very simple amendment brought to us by the LSO, technical correction. One word was omitted, and you have to read it several times to see that that was what happened, but it did. The difficulty in getting these things properly proofread, it's just about impossible because your mind just automatically puts in what's missing. But they caught it, Mr. Chairman, and that's what it does. It's just a technical correction. I urge its adoption.
Question on the standing committee amendment? The question is on Senator Scott's motion to adopt the standing committee amendment. All those in favor signify by saying aye. Aye. Opposed, no.
Mr. Chairman.
Amendment is carried. Senator Scott.
Mr. Chairman, I yield to Senator Landon for an explanation of the Senate file.
Thank you, Senator Scott. Senator Landon.
Thank you, Mr. Chairman. I've really been put up against the blaze by the senator from the Bighorn Basin. I'm not sure I can get through it quite as quickly as he did his, but I'll do my best. Senators, this is a bill that comes to you from your Select Committee on School Facilities. The purpose of it is to streamline, kind of increase some transparency in our process of prioritizing and assessing all of those school buildings out across the state. And just for reference, for those who maybe aren't aware of this, I just always think it's kind of interesting to kind of give you some benchmarks of what we're taking care of out there. We have 347 school buildings out across Wyoming that we are responsible for. That's over 25 million square feet, and 23 million of that is in the educational space alone. What 25-15-115 and 21-15-117 do generally is govern the assessment of school buildings and help us to prioritize all of what we're going to do out across that fleet that we have in school buildings. This bill is a result of a collaborative effort, Mr. Chairman, from the School Facilities Commission which always does work, and then it presents to your school facilities select committee. That goes on up through the process, through the Joint Education Committee and on to you. Generally speaking, the bulk of the amendments of this bill rest in those two statutes that I just told you about. The bill clarifies that the School Facilities Commission is required to prepare 3 remediation lists. Up to this point, we had 2. We had capacity, and then we had condition. Well, in your statute, you can find it in 117, 2115, 117. That's where you find educational suitability. Well, what the School Facilities Select Committee has been up to the last 2 years, Mr. Chairman, is to try to identify exactly what that is. And in short, we're talking about things like air quality, illumination, the appropriateness of the student environment. That's what suitability is. It really hit home to me, senators, when I went down and visited a school district downriver from where I live. The good senator from that part of the world will know that that they've got a terrific superintendent. She toured us around some facilities and showed us some areas that there really was no remedy for. That they can't change a classroom, for example, if they'd like to split it in 2 or get rid of a wall, those sort of things. What about if you're having to use a maintenance area for a classroom? Well, that might be a remediation that we would want to pay attention to, and get some lighting in there, get some tech capability so that the students are in the right environment. So what we did with this bill is we added a 3rd level that we want our team that goes out and assesses these facilities every 4 years. It's in the statutes that they go out and tell us what we have out there. It isn't going to rank as highly as capacity and condition, but it's going to be included. And so that's really what the bill does, Mr. Chairman. Just a couple of points in the bill that I would point you to, a couple of areas. Page 7 and 8, that's where we create those lists that I just talked about. We add one thing down on the bottom of page 8, that's the condition, capacity, and suitability. Page 14 is where we do bring in some language to attempt to create some efficiency by using similar designs for schools. That has actually happened in the past, but what we're trying to do in the statutes here is to assure that we give the backing to our commission to do as much as they can to utilize cookie cutter schools, use the same plans for multiple locations. It gives that kind of backing to the commission. And it makes it clear that the guidelines do not apply to major maintenance, but just for construction down the road. If there's a design that's laying on the shelf, we're going to encourage people to use it and perhaps save a little money along the way. That's probably enough on the bill, Mr. Chairman. That's what it does. We're going to get a pretty good look at our buildings when that team of folks goes out to assess them, and it's going to include educational suitability. Thank you, Mr. Chairman.
Much appreciated, Senator Landon. Discussion on the bill. Senator Scott.
Mr. Chairman, I asked the Senate to pay careful attention to this bill. We've got a real decision to make here. Mr. Chairman, this bill, I'm convinced, will marginally improve our current system. It may cost us a little more. I'm a little scared that some of the suitability language will broaden the eligibility just a little, and we'll get a few more buildings to build. But, Mr. Chairman, the reason I say we've got a decision to make, we've got to do something radically different in this area. Our budget here has depended, and we all know this, on the coal lease bonus monies. That's what's funded this. They're gone. They aren't going to come back. So if we keep with this system, we're going to have to mentally think we're going to have to put a lot of money that is now going to the general fund or something else. It'll wind up hitting the general fund into this program. Second, we've got real problems with this program. I sort of knew there was a problem, Mr. Chairman, but when I got made education chairman, I said, well, I better take a harder look at this. And I added up how much we've spent. It was the Campbell 2 decision that made the legislature responsible for funding all the school capital construction. If you use the year that the biennium that decision came down as a starting point and go through to the present, through what we've done for this biennium, we have spent $3.9 billion with a B on school capital construction. Now, that includes the major maintenance. And I was going to leave that out and say, well, we've spent 2.8, just under 2.8 billion on the capital construction proper and another billion plus on the major maintenance. But staff pointed out to me a lot of the particularly early spending on major maintenance was catching up on the deficit that we inherited from the 90s, where the larger districts in particular stopped maintaining their buildings so they could pay their teachers. Now, that's a lot of money, 3.9 billion. We inherited some of that problem. We had an outfit called MGT, went and did a study that was quoted in the Campbell 2 decisions. We inherited $563 million worth of problems that they identified as being needed to be fixed. And there was inflation. The inflation between then and now on the Wyoming Cost of Living Index, that's not a building index. It's probably a little less than what the building index was, but the inflation was 79%. We spent most of the money to catch up on that in the early years. So you probably got to count half of that inflation, and you wind up with justifying 786 million. There was 11 million of new construction for capacity reasons. It was identified in that Campbell 2 decision. And that's probably accurate. The school enrollments had come down quite a bit at that point. They've since stabilized. We're 1,900 students more now than we were then. The growth is not even necessarily across the state. There's several counties that have grown when others were declining. So there is some justified there. Some of the major maintenance is spent preventing future problems. So I think you can justify, you pick your own number. And I passed these figures out in a little 2-page paper I passed out this morning to everybody. You can see for yourself. We probably can justify $1 billion, billion and a quarter, something like that, of the 3.9 we've spent. Mr. Chairman, what's happened is when the Supreme Court legislated from the bench on this one, and they did, they created a system they're not suited for legislation. They don't do it with public hearings and careful consideration. The alternatives, they do it on legal reasons. I don't think they realized they were creating a pork barrel program, but that's what they did. Because all of us defend our home district, what they want. We figure that's part of representing. And none of us know enough about somebody else's district to say, no, what you're asking for is unreasonable. And we don't want to do that anyhow. So we're faced with a system that has given us, and there were some big years and some little years, more little years recently, but an average 250 million roughly a year in spending we did not need to spend. I think it's too strong to say it's wasteful. We built some very nice school buildings. I would describe some of them as palaces. They're very nice. Some of them are expensive. But we need an entirely different system, Mr. Chairman. So question with this bill is, are we going to tinker with the old system? Or when we get to third reading, are we going to say, enough is enough with the old system? Let's not tinker with it anymore. Let's get rid of it. Because we cannot afford what we've been doing. We need to go back to a system where the people make the decisions locally, because they do it better than we do. So, Mr. Chairman, that's the decision that faces you with this bill, and I ask you to think about it between now and third reading.
Thank you, Senator Scott. Further discussion, Senator Landon. Oh, I'm sorry, Senator Landon, let me get Senator Wasserberg because he hasn't been up yet. We'll let you back clean up. Senator Wasserberg.
Well, thank you, Mr. Chairman. Just real quick, as I look at this, I can't hardly see it on my computer screen, but essentially what we're talking about with suitability is technology readiness.
You might point that microphone at you instead of.
Technology readiness, air quality, which we have HVAC systems in all our schools. We have technology readiness in all our schools. Lighting, illumination, all our lighting in our schools is important, and an appropriate student achievement. So I disagree with the chairman of the Education Committee saying this is going to cost more, because we've been doing this for years. It's not something that's new, and I don't think it's going to cost us any more money. It's going to cost us money, as we all know, and a large part of that money came from Campbell County and the COLEAS bonus funds. So I think that actually the proposal from the School Facilities Committee is one that the cost of a square foot in construction is going to be relatively the same. It's not going to be an increase. And if it is, it's a small increase just because of another year and another year of inflation. So thank you, Mr. Chairman.
Thank you, Senator Wasserberg. Senator Rothfuss.
Thank you, Mr. Chairman. On for the bill, and I've served on the School Facilities Committee for the last decade, along with the chairman, and a number of other members have been on there for quite a long time. And there's no question that we have some issues, I would say, with the nuances of how we construct schools, and boy, we've been through a lot of interesting things over the years on that committee, trying to get things right. This is an improvement certainly on the existing system, but it doesn't mean we couldn't come up with a better system. There's no question that if we worked hard, we probably could scrap the one we've got and come up with something that does a better job. I say that, but I don't know what it is, quite honestly. It's not for lack of thinking about it on the select committee that we don't have something entirely different. We sit around having lunch or dinner or whatever else, just sitting at the table during breaks, speculating on just that. How could we do this better? What could we do differently? And it's a challenge. It's a hard one to get right. We obviously need great schools. We want it to scale appropriately. We know that we've got small districts that don't have the expertise to plan way ahead. So that gets us the School Facilities Department and the commission. Then we've got large districts that struggle because they do have the ability to be independent. They want to plan many different schools at the same time, but our priority system doesn't quite work as well as it could for that. So there are definitely challenges built into this system. But I would encourage the body that this is an improvement. It's an incremental improvement. And I would encourage the body to support this legislation. And then if we do see a better system through legislation, perhaps that we work on during this next interim, if that's the direction of the management council on assigning topics and of this body, if that's the will of the body that we want to try and look to an entirely different system, let's do that. But let's do that during the interim. Let's pass this bill because it improves the current system. And let's not throw this one out because we have a grander vision. Let's make that incremental improvement, recognizing that that this does move us in the right direction and improves the system that we're currently operating under despite its flaws. At the same time, Mr. Chairman, the last thing I wanted to address is the cost. The statutes at this point in time, because we've kind of moved past the requirement to fix that backlog of problems that was created when we didn't fund school buildings, and we certainly didn't fund major maintenance, right? That's the backlog the good chairman mentioned. We had to catch back up. It was extremely expensive to catch back up, and we're in good shape now. Our schools are exceptional. So most of the work that's done and most of the expenditures, really, it's setting a prioritization list, and then we come to the legislature and we say, all right, how much have we got? And then you just kind of run the list based on priorities. It might be a component, which is like a new boiler or a new roof. It might be an elementary school. It might be trying to save up for a new middle school. We've done each of these things over the last few years. But we're at a point now where the statutes are certainly not a driver of expenditures. The budget drives the expenditures. How much money do we have? All right, well, what do we need? What's at the top of the list? That's where we're certainly at right now with a constrained budget. And to be honest, we mentioned this a little bit earlier, we're constraining major maintenance at this point far beyond where we should, Mr. Chairman. We know that it's an unhealthy approach to major maintenance in the long term, but again, we're following it because we're revenue constrained. So I'd encourage the body not to read into this legislation as being more expensive, because the process is set the budget, look at the list and see what the priorities are, spend accordingly, Mr. Chairman. Thank you.
Thank you, Senator Rothfuss. Senator Landon, I want to get back to you.
Thank you, Mr. Chairman. One thing about it, you can't ever question the passion of my friend from Natrona County, but sometimes you can question maybe which road he's on or something. But I wasn't sure. I didn't realize we were going to go all the way down this road, is what I mean. But now that we've gone there, I just want to throw out a couple of things for everyone to remember. I told you how much of a fleet we have out there. Over the course of that time that the senator pointed to, we have affected over 100 school buildings. And we think they will last for the next 70 years. But that means 3/4 of the fleet out there is going to need our attention at some point. Just something to think about. So no matter what program we come up with, I would suggest that we ought to take it about 1/4 of the fleet at a time and try to shoot for 70 years. And depending on the major maintenance that we put into those buildings, maybe we can make them last till they're 80 years old. We're in great shape. As the senator from Albany County pointed out, we're in good shape, folks. Our schools are in great shape. When we come down under this system, it's up to this Senate. We're the ones that decide what we're going to put into this. We can cut major maintenance. We don't have to do any component projects. The component projects is what keeps our HVAC folks, our electricians, our plumbers. That's what they're doing. We don't have to build a new building. We might want to we've already gone into a maintenance mode. And frankly, over at one of our districts that's growing the most, we're just adding a couple of classrooms onto a middle school over in the President's neighborhood. We are going to need some capacity schools, Mr. Chairman, and the need for those facilities as we go, and we know we're going to have to probably build another school up in Teton County. We have to have a way to analyze and to prioritize what we're up to out there, and that's all this does. Ultimately, this comes down here, goes through education, goes over to the Appropriations Committee, and they come out with a recommendation. And then we talk about it out here. That's all this system is. And I'm proud to say, sure, we probably laid down a couple of schools that we can look back on and say, boy, we shouldn't have built that school. But you know what? It's also something we ought to be pretty proud of, because we have really put Wyoming in a good spot. And you know what? None of those facilities that I alluded to just now, 100 of them, your constituents are not paying off a bond issue right now on any of them. And it affected all 48 school districts. So it's not all dark. There's some sunshine in there. I think I commend this bill to you because I think it will help us to prioritize better and analyze that list of all of that fleet out there, Mr. Chairman. I hope that clarifies a little bit of what we've been up to the last 20 years. So thank you.
Thank you, Senator. I'm sensing that you're ready for the question. The question is on Senate File 2 and Senator Scott's motion that when the Committee of the Whole rises to report that it do so with a do pass recommendation on Senate File 2. All those in favor signify by saying aye. Opposed, no. Senate File 2 has passed Committee of the Whole. The next file for our consideration is Senate File 155. The reading clerk will please read the file.
Senate File 155, limiting firearm seizure and regulation during emergencies, an act relating to Homeland Security sponsored by Senator Driscoll, was referred to Committee Number 1, which returned to committee recommendation that it do pass. Ayes, Senators Cooper, French, Kolb, Cost, and Nethercott. Senator Nethercott, Chairman.
We've heard the reading of the file. What is your pleasure, Senator Nethercott? It's 155.
Oh, thank you, Mr. Chairman.
It's
That is my bill.
limiting firearm seizure and regulation during emergencies.
Mr. Chairman, thank you. I move that when the Committee of the Whole rises to report, it do so with a favorable recommendation of Senate File 155, limiting firearm seizures and regulation during emergencies. To explain this very American bill, I would refer to Senator Driscoll.
Thank you very much, Senator Nethercott. Well done. Senator Driscoll.
Thank you. That was a shot from the hip. Folks, from the hip. So, folks, this is a pretty simple little bill, and I'll go through it pretty fast. No amendments on it. This bill only applies during emergencies, and what it is in different states, we've run into the things this deals with, and the bulk of the bill falls onto page 2. The biggest part of this bill's already in statute and codified, but it adds on line 8, it adds the double Romanet I, impose additional restrictions to lawful possession. We added permitting, transfer, sale, carrying, and storage of firearms. And we added other personal weapons. Same thing on line 14 and 15, and then you get line 17, line of the meat of the bill. Romanet III, closer limit to operating hours, any person or entity engaged in lawful selling or serving any firearm, ammunition, personal weapon, other component thereof, less the closing or limitation operating hours applies equally to all forms of commerce within the jurisdiction of the state, political subdivision, or governmental entity. Folks, what this does says if they're going to close down a firearms business, it's treated equally with other businesses. They can still do it, but if we're going to do a blanket closure, we can do it, but you can't single out what's in this category, which is firearms, ammunition, et cetera. Get some funny looks on that, but this actually has happened in other states. This is something that does happen, and it has happened. Got a local person doesn't like guns, just use the example to shut the gun shop down. So then we move on to page 3, little Romanet IV, close or limit the operating hours, indoor, outdoor shooting ranges. Same thing, don't close the range down for fun. Little Romanet V, place restrictions on quantity limitations or on any entity regarding the lawful sale or service of any firearm, ammunition, personal weapon, or any component thereof. Speaks for itself, just says you're not going to limit it down to where you can't do it. Last one's on line 10, suspend or revoke a permit to carry a concealed weapon issued pursuant to Wyoming Statute 68401, unless the suspension or revocation is authorized and pleaded pursuant to Statute 68401. Just says you can't arbitrarily pull a concealed carry permit. You got to use procedures to do it. That's the bill. One thing I will tell you, we did have testimony came from Good City down here that actually owns a firing range, and they said, you've put us in a bad spot. So there'll be an amendment coming that says we're exempting out public-owned facilities from that, because we really tie their hands. If we leave it the way it is, they're stuck, because they're the ones that do it. So for those facilities that are actually owned by a public entity, the example they gave down here, they're rationing ammunition right now. And they're not doing it because they want to do it. They're doing it because they don't have enough for it to go around. They have to ration it. So we'll be bringing an amendment on it. I point out once again, it's only during emergency times. With that, I'd stand for further questions and ask for your favorable consideration.
Thank you, Senator Driscoll. Who's got a question? Any discussion? Seeing none, Senator Rothfuss.
Thanks, Mr. Chairman. I do have a question on the details of the closures aspect of it. And I just wonder how this language comports with on Romanet 3. It's pretty strong phrasing that it has to apply equally to all forms of commerce within the jurisdiction of the state political subdivision or governmental entity. Is that really the bar that is intended? Because that seems to mean that if there's any entity anywhere that has commerce, that there's no way that you could shut down a range for a public health order, or I guess that's not a range, that it's the next one that's the range, but this would be a store selling guns or limit the hours. Do we do that anywhere else? Is there any other similar language elsewhere in statute? I'm just curious, because again, there's a difference between precluding discrimination against a store selling firearms and ammunition versus giving it a superior position, which is what this appears to do, where I would say no other entity in the state would be as empowered as your local ammunition store at that point. So I'm curious about the parity and whether the sponsors worked that or looked at that. And then the next question I have is just with regard to the point 4, which indicates apparently that there's literally no circumstance under which you would be able to close or limit the operating hours of an indoor or outdoor shooting range. I understand an amendment's coming to make that so that it excludes a public shooting range, but I'm curious why the parity standard didn't engage on this particular Romanet. So what it seems is, all right, the rec center has shut down in the community. The ice skating rink has shut down. All the basketball courts are shut down because we've got an incredible pandemic. Everything in the community has been shut down by some type of order or another. But the only place that remains open is your private local shooting range, which under no circumstance of any public disaster, pandemic, or ill could be closed. And I was wondering if that might be a little too strong. So thank you, Mr. Chairman.
Thank you, Senator. Anybody else? Senator Driscoll.
Mr. Chairman, I'll come back. I'm gonna have to do a little research. I'm gonna ask you to pass it on. But I would point out, this is all under 1913-104, which is the powers generally Director Office Homeland Security. And it falls in a section of law on the closures. And I don't believe it makes it where it's them on their own. It puts them in a category. If we go up, I don't have the green books laying here. I've got the 2 wrong ones here. I didn't manage to bring that one. But it really is, even on the closing or limiting in all forms of commerce, my answer would be yes. If there's anything open, there's no reason that they can't be open. I'll stand behind that fully. If you got anything open, these don't tend to be places of huge congregation, and they're just good businesses. And it falls in what happened this time, and it really does, is we managed to keep the box stores open. They managed to sell all the time. This poor little guy down the street falls under the wrong category and gets shut down because that's all he does. So I do think that's a good part of it, and kind of stand behind it, but I'll try to get back to you on the other one. I'll pull the statutes up and try to track it in and find out, because it's a good question.
Thank you, Senator. Thank you, Senator Driscoll. Okay, ready for the question. The question is on Senator Nethercott's motion that when the committee of the whole rises to report, it do so with a do pass recommendation on Senate File 155. All those in favor say aye. All those opposed say no. Senate File 155 is passed committee of the whole. The next file for our consideration is Senate File 93. The reading clerk, please read the file.
Senate File 93, Witchy Repayment Program, Veterinary Medicine Students, an act relating to the Western Interstate Commission for Higher Education, Witchy Repayment Program, sponsored by the Appropriations Committee. Was referred to Committee Number 2, which returned to committee recommendation that it do pass. Ayes Senators Guru, Kinsky, Perkins, and Steinmetz. No, Senator Hicks. Senator Perkins, Chairman.
You heard the reading of the file. What is your pleasure, Senator Perkins? Were you going to make a motion on this? Senator Perkins. Would you
Thank you.
care to make the motion on Senate File 93?
I move that when the committee of the whole rise and report that do so with a favorable recommendation on Senate File 93 and for an explanation of the bill, would you please call on the good senator from Goshen County and other parts to the east and north of here?
I'd be delighted, good Senator. Senator Steinmetz.
Thank you, Mr. Chairman. Well, we bring you a good little bill here called the Witchy Repayment Program for Veterinary Medicine Students. The Witchy program is the Western Interstate Commission for Higher Education. This bill requires that students participating in Western Regional Higher Education Compact veterinary medicine programs to actively engage in full-time professional practice in Wyoming for not less than 3 years or repay all amounts expended by the state on the student's education. This bill, folks, most of the meat of the bill is on page 2, and that's just where we're adding veterinarians and to all the other list of folks who repay these loans, and to make it fair across the board. Right now, veterinarians are basically the only ones in this program that are not required to work here for 3 years or pay back their loans. And so we have dentistry, medicine, podiatry, occupational therapy, physical therapy, optometry, physician's assistance programs. All of that list of folks are required to play by those rules except for our veterinarian students. And so we just thought that it was fair and equitable to make this apply across the board to everyone in the program. So that's basically the bill, and I'd stand for any questions.
Any questions for Senator Steinmetz? Any questions? Seeing none, I see there's a committee of the whole amendment. Who's offering that? Could we have the committee of the whole amendment read in?
Senate File 93, Committee of the Whole Amendment Number 1, page 1, line 4 after.
Senator Guru.
Mr. Chairman, I move Committee of Whole Amendment Number 1 to Senate File 93 and will now explain the amendment.
That's a good idea.
Thank you, Mr. Chairman. I thought so too. As my good friend from Goshen County said, the intent of this bill is to make things fair and equitable. And of course, I would bring an amendment that, as you would expect, to make it just a little less fair, maybe at first glance, and maybe even with a little tortured logic. But bear with me. If you look on the amendment is on page 2 at line 14 and says, if within 3 years following the conclusion of professional training, the student is not able, after diligent efforts, to attain a professional position in Wyoming in the field of which the student was educated, and for which the annual monetary compensation equals or exceeds 1/2 of the national average of the educational debt for that profession, then all unpaid repayment obligations incurred under this article shall be waived. What does that mean? Here's the problem. Veterinarians, a lot of our best and brightest youngsters from rural areas a lot of them want to become veterinarians, want to go to veterinarian school, and they go and they find that the cost of which is when they're finished is very high. Unfortunately, like in this particular case for veterinarians, especially large animal veterinarians in our state, the pay is very low. And so the repayment differential is high, much higher than in some of these other professions that are listed in the WICHE program. So what happens? These kids are forced actually to go out of state where they can maybe work down on the Front Range and take care of Fido and places in, in the big city and make more money. And they want to come back. And usually they come back in 5 or 10 years. With this amendment, they're actually willing to come back for half the money if they can find a job in Wyoming that at least pay that. And if they can't, they want to be able to be relieved of the obligation so they can pay back the rest of their debts, because this is only a part, the Witchy debt. Pay it back, and so they can get back quicker. If they can get a job, even for less money, they'll still come back. They want to be here and they want to be a part of it. And that is the point of this. And as I thought about this, they brought me this and I kind of thought about it a lot. Boy, I don't know. But then the more I started to think about it, what is it that we're looking for? We're looking for the kids to come back. We talk about it all the time. The best and the brightest. We want them to be back in our state. Well, this is a way we can actually help them get there. And maybe we might start to look at it for some of the other professions as well. Maybe it might be a way to bridge that gap if they're willing. That's the essence of the amendment. I'll stand for your questions and urge your support on Committee of the Whole Amendment number 1. Thank you.
Thank you, Senator Guru. Questions on the amendment? Senator Cost.
Thank you, Mr. Chairman. I rise in support of the amendment mainly because I've got a letter from a young person that's been accepted into the Witchy program and wants to gain more knowledge, but the limitation of what they're able to gain in the state is rather difficult. Plus, the opportunities for jobs is extremely limited. We need more veterinarians working with our large animals, our cattle and that. There's no doubt that those are not the glamorous jobs that working with the small dogs and the cats are in some of the cities. But if we can get these people back in here to work with our cattle and sheep and that, it's going to help us out. So the idea that there's not that many openings, the idea that it's difficult for these kids to get in here, I think this provides an opportunity, and I'm not so sure that he isn't right that down the road, maybe we need to look at that a little bit in some other areas as well, so we can bring them back in here too. But for now, I think this is an important move to assist us in this area that's a little shy on personnel in the state. Thank you.
Thank you, Senator. Anybody else? Who else would like to address it? Senator Beitman. Let me get you lit up. There you go, sir.
Thank you, Mr. Chairman. What's the price tag on this amendment? Thank you.
Thank you, Senator Beitman. Senator Wasserberg, do you have a question?
Well, thank you, Mr. Chairman. I do have a question, which was relatively close to the good senator from Sheridan County.
You got to point that mic back at you. You keep wanting to point it at the ceiling. There you go.
And so would ask that we look into, or at least we are shown what this would cost to our Witchy program. And I would also point out that I think this is a dangerous path to start out with, because in our WWAMI program, it doesn't matter if you don't come back to the state of Wyoming, you pay off your loan. There's no forgiveness if you can't get into the state. That's just the way it goes. And so in the Witchy program, I always thought that it was relatively the same thing, except for in different professions. And so I'm worried about if we do this, are we going to do this for our medical doctors too? And then at the end of the day, our incredible percentage of success, I think it's a 70%, would ultimately, I think, go down. And I would hate to see that happen in this state. So I'm very much in favor of the bill. I'm not real sure and would like the sponsor to explain what we're doing here with the amendment.
Thank you, Senator. Looking around, Senator Steinmetz.
Thank you, Mr. Chairman. While I don't usually disagree with my good Appropriations Committee member often, I would ask you to vote against this amendment. It kind of goes against what we are trying to accomplish in this bill, which is to make everything fair and equitable. So for example, I would just take you back to some of the testimony that we heard during committee. We were looking up occupational therapy because we were told that occupational therapists they needed to repay their loan back, but not our veterinary medicine folks, because they didn't make as vets don't make as much money coming out of vet school. So I went ahead and looked it up. They make $85,000 coming out of vet school, which is what they told me. But our occupational therapists only make $81,000. So I said, well, okay, here's the salary split. And don't you think it would be fair for you to have to pay your loan back? Well, they said no, because our loans cost a lot more than what an occupational therapist has coming out of school. They have a lower loan rate than we do, which they both had about $200,000 of debt. So while I understand the sentiment toward our large animal veterinarians, because we really do need them in the state of Wyoming, and we really do rely on them. This has nothing to do with large animal vets specifically. This is everyone in the program. So I'd urge you to defeat the amendment and vote aye on the bill. Thank you, Mr. Chairman.
Thank you, Senator. Senator Baldwin.
Thank you, Mr. Chairman. Just a quick note of information for the floor. As I serve as a WICHE commissioner, we have 16 states and 1 associated states, which is Guam and the Pacific states. Of all those 17 groups, we are the only state that has any exemption on anything in the WICHE program of any kind. All those other states require full repayment if that obligation is not fulfilled for 3 years. I've just thrown it for information. I'll be a no on the amendment and an aye on the bill. I think it needs to be fair across the board, or else we're going to be hearing from the optometrist and all those other folks on that list eventually down the road. If we don't change this, they're going to say, what about us?
Thank you, Senator. Senator Hicks.
Mr. Chairman, I was actually a no on this in the Appropriations Committee, and I am going to support the amendment. So we have these conversations all the time. What's the unintended consequences of our action? Well, here's one that I can actually help you understand some of the unintended consequences associated with not adopting the amendment. And the testimony that we had is most all of these students, not only do they go on to vet school through the WICHE program, but while they're at the university, they're enrolled in the vet science program over there, which works in the vet lab over there. And the biggest concern that we had was that if we eliminate this program, we're going to
Get closer to your microphone, Senator, if you wouldn't
we're
mind.
going to significantly reduce the number of people enrolled in that program. And that vet science lab is not only critical to the University of Wyoming and the College of Agriculture, it provides significant other services to the rest of the state of Wyoming for diagnostic purposes, for livestock diseases and wildlife diseases scattered around the state of Wyoming. When they come into that laboratory, so there is a significant unintended consequences by eliminating this program is we have the potential to jeopardize having enough qualified students working in that veterinarian lab over there at the university to service all those other areas within the state of Wyoming. That's the unintended consequences. So on and for the amendment.
Thank you, Senator Hicks. Working my way around the room, not seeing anybody. Senator Grew, would you like to clean up?
Thank you, Mr. Chairman. Like I say, it does on its face seem a bit of a different logic. But like I say, Wyoming is different, and we're facing issues that some of the other WICHE states aren't facing. We do have a shortage of veterinarians, large animal veterinarians, in our state, and we were trying to figure out a way to bring them back. And I know we will hear. I think we will hear from the other disciplines. The question is, should we maybe look at them as well? I don't know, but I do know this one, and I'm in favor of it, and I urge you to support the amendment. Thank you, Mr. Chairman.
Thank you, Senator Grew. Senator Nethercott.
Mr. Chairman, members of the Senate, have I mentioned to you the crisis that Wyoming is currently experiencing?
Was this the lawyer shortage, Senator Nethercott?
Take note, there is a lawyer shortage, and those who would defend your Second Amendment rights. A crisis is underway.
Anybody else? Are you ready for the question? The question is on the Committee of the Whole Amendment number 1 to Senate File 93. All those in favor signify by saying aye. Opposed, no? No. The amendment has failed. Division being called. All those in favor, please rise. Need a stretch anyway.
Good call, Chair.
All those opposed, please rise. The amendment has failed. We're back on the bill, Senate File 93. Any further discussion? Any further discussion? You ready for the question? The question is on Senator Baldwin's motion that when the committee of the whole, who had the motion? Education? Appropriations, I'm very sorry. Thank you. Senator Perkins' motion that when the committee of the whole rises to report that it do so with a do pass recommendation on Senate File 93. All those in favor say aye. Aye. All those opposed say no. No. Senate File 93 is passed committee of the whole. The next file for our consideration is Senate File 115. Would the reading clerk please read the file?
Senate File 115, Education Pupil Teacher Contact Time, an act relating to education sponsored by Senator Cost. It was referred to committee number 4, which returned to committee recommendation that it do pass. Ayes, Senators Beitman, Ellis, Rothfuss, Salazar, and Scott. Senator Scott, Chairman.
You've heard the reading of the file. What is your pleasure, Senator Scott?
Mr. Chairman, I move in the committee of the whole rise and report to do so with the recommendation that Senate File 115 do pass. I yield to Senator Cost for an explanation of the Senate.
Senator Cost.
Did you want to do the amendment now or later?
It's a committee of the whole amendment. Let's talk about the bill first. You can.
Okay. Senate File 115. To give you a little example, where this came from was the problem we have right now is that our teacher pupil time is directly correlated to brick and mortar time or virtual school if they're in a virtual school. To get a blended or an innovative instructional period out there so that our kids have options and that we can do some things differently, this bill opens that door. This gives our districts the ability to say we can do a little of both. The nice part about it is with the pandemic and the things that our districts have had to do virtually to match in, this bill will allow some of that moved in with brick and mortar so that we have options available to our kids. It's a simple, short little bill to say, and the Attorney General is the one that had suggested that because of this, the way it's written, the State Board of Education would be the ones to probably best answer this. It doesn't have to be them, but the State Board of Education was the suggestion. To follow through the bill, basically you come down to where the amendment is going to be put in. It's on page 1, in addition to subsection A of this section, and any other duties assigned to it by law, the state board shall. And then on page 2, I would ask, right, and I would really like to have the amendment read in now, so you want me to?
Hold on, let me do this.
Okay, you do it.
All right. Any further discussion on the bill at this point? Hearing none, let's have the amendment read in.
Senate File 115, Committee of the Whole Amendment number 1, page 1, line 7, delete.
Senator Cost.
Thank you. I would move for the approval of Senate Standing Committee number 1.
It's Committee of the Whole Amendment. Senator
Thank
Scott.
you. I'll get it right. Committee of the Whole Amendment number 1 to Senate File 115. And here's what it says. The reason that we added this was a little bit too loose when the original bill came out, and we wanted to put a little bit more of a parameter on it. So instead of the line page 2 lines 1 through 3, which was extremely short, we deleted all of that and we moved to on lines repeating. Boy, I'm stumbling around great. Hang in here. We're inserting on page 2 lines 1 through 3 Romanet VIII, which is approve or disapprove alternative scheduling for school districts requesting to operate for fewer than 175 days in school year, but no schedule shall be approved which reduces the minimum pupil-teacher contact time required by the state board. The state board shall establish by rule for grades kindergarten through 12 minimum pupil-teacher time requirements during which students are to receive instruction, which may include instruction outside of the physical classroom through virtual education or other equivalent methods the state board deems appropriate. This gave us some better sidelines on this particular bill. I would ask that you approve the amendment, and then we'll also approve the bill.
Thank you very much. Discussion on the amendment? Any discussion on the amendment? Seeing none. The question is on Senator Cost's motion to adopt the committee of the whole amendment number 1 to Senate File 115. All those in favor signify by saying aye.
Aye.
Any opposed? No. The amendment is carried. Back on the bill. Anything else on the bill? Anything else on the bill?
Question.
The question is on Senator Scott's motion that when the committee of the whole rises to report that it do so with a do pass recommendation on Senate File 115. All those in favor signify by saying aye.
Aye.
All those opposed, no. Senate File 115 is passed committee of the whole. The next file for our consideration is Senate File 74. The reading clerk will please read the file.
Senate File 74, Athletic Trainer Revisions, an act relating to athletic trainers, sponsored by Senator Landon, was referred to committee number 4, which returned to committee recommendation that it do pass. Ayes Senators Beitman, Ellis, Rothfuss, Salazar, and Scott. Senator Scott, Chairman.
For the reading of the file, what is your pleasure, Senator Scott?
Mr. Chairman, I move in the committee of the whole rise and report it do so with the recommendation that Senate File 74 do pass. Yield to Senator Landon for an explanation of the Senate file.
And he's a true athletic supporter, Senator Scott. Senator Landon.
Thank you, Mr. Chairman. Mr. Chairman, this is a two-page bill, so I'm going to hurry a little bit this evening to try to get us finished up. I think you can see what the bill does, but it does 3 things. It changes the definitions for athlete and for athletic injury so that we can expand this little practice act for our athletic trainers. You go on to page 3, and there is a provision for telehealth services. I like that feature of the bill, Mr. Chairman, particularly because of the tightening that we're going to need to do in our K-12 system. I think it is really terrific if we can provide for an athletic trainer being able to help a smaller district out there, for example. And then finally, we do add the provision that the board would draft some rules and regs regarding additional services for a declared state of emergency. That is what the bill does. Just to give you a little more reasoning, having been an official, I've been around the gymnasiums, the athletic fields, my entire life.
True supporter.
And the fact is, as it stands today, the athletic trainers cannot work on somebody, say a PE teacher or a referee, or maybe somebody out of the band. And that's all this does. It allows for a teacher, for example, at the school to come by and get a look with the athletic trainer. They work very closely with the physical therapists out there. There'll be referrals and all of that, but that's what the bill does. I hope you'll support the bill.
Thank you, Senator Landon. Any discussion on the bill? Any discussion on the bill? The question is on Senator Scott's motion that when the committee of the whole rises to report, that do so with a do pass recommendation on Senate File 74. All those in favor say aye.
Aye.
Opposed, no. Senate File 74 is passed committee of the whole. The next file for our consideration is Senate File 119. Would the reading clerk please read the file?
Senate File 119, Investment of State Permanent Funds, an act relating to public funds, sponsored by the Appropriations Committee. It was referred to committee number 2, which referred to committee recommendation that it do pass. Ayes Senators Grew, Hicks, Kinsky, Perkins, and Steinmetz. Senator Perkins, Chairman.
For the reading of the file, what is your pleasure, Senator Perkins?
Mr. Chairman, I move that when the committee of the whole rise to report that it do so with a favorable recommendation on Senate File 19, investment of state permanent funds. And for an explanation of the bill, I would ask that you call upon the good senator from Sheridan, Senator Kinsky.
Point of order, Senator Rothfuss, let me get you lit up.
Thank you. I may have misheard, my apologies if I did, but I heard Senate File 19 on the motion.
Let's
And
just
if-
redo it
if
just
I-
in case.
If I heard wrong, my apologies.
If you don't mind, Senator Perkins, just redo it again.
Sure. I move that when the rise to recommendation on. Does that help? I move the committee whole rise report, do so with a favorable recommendation on Senate File 119, investment of state permanent funds, and ask that you would call upon the good senator from Sheridan, Senator.
Senator Kensky, thank you very much, Senator Perkins.
I think, I don't think I'm the good senator from Sheridan, but I don't think he wants to address this bill. Thank you, Mr. Chairman. This bill is, relates to investment of state permanent funds. And it relates to the requirement that we invest in a portfolio that is at least 70% equities, 30% fixed income. And this takes that just one step further. And so the operative provisions of it, if you turn to page 3, so that we can review the concept, because the concept here.
So time out for a second, Senator Kiske. This bill jumps from page 1 to page 3. Does anybody, at least my copy does. It's a front and back. So if all of you got 3 pages, raise your hand if you do. Let's keep going and we'll get me fixed. Go ahead, Senator Kiske.
Okay, so the operative provision is on page 3. And let's just read through it together. Investing monies of a fund or account, which may be invested in the stock of a corporation or other equities, the overall risk profile of the investments, excluding any specific public purpose investment authorized by the legislature. So that's where we make loans. That's an investment we're just not going to include in this. These investments shall not materially exceed the risk profile of a reference portfolio that consists of 70% global equities and 30% domestic fixed income investments. Then it goes on to say that, you know, what this reference portfolio, the state treasurer is going to consult with the investment funds committee and so forth. But the operative concept is the idea that we're looking at 70-30 as a reference portfolio and backing into and saying, we don't want to take any more risk than that reference portfolio. And then you go out and invest accordingly. So the idea here is set your risk level based on a global equities, 70%, domestic income, 30%, whatever risk that level is, then set that risk level, and then you can back into what you're permitted to invest in. And the reason for that is that the idea that, you know, in the olden days, there was equities and there were bonds. And the bonds were either government or investment grade bonds. And the equities were, you know, the Dow Jones or the S&P 500. But the world has just gone way beyond that to now where you can actually find equity funds that perform more like a bond and bond funds that perform more like an equity. So what the chief investment officer does is look at their volatility and looks at their return and their risk profile, and then makes the investments according to how risky or not risky, what kind of return or not that you get. So for an example, one investment is a bank loan index that has a volatility of 10.6%. It's can swing 10.6%, I think 2 standard deviations. Then there's emerging market debt indexes that have a higher volatility. Those are bond funds. So a bank loan index and a emerging market debt index, those are bond funds. But the volatility of those is higher than private equity, which has a volatility of 9%, real estate, which has volatility of 7.2%, or hedge funds, which has a volatility of 7.2. Those are all considered equities. So the conventional wisdom just doesn't hold anymore. That bonds are safer than stocks. Sometimes there are some stocks that are less safe than bonds. So the idea is by creating a reference portfolio of what we conceive of traditionally as stocks and what we conceive of traditionally as bonds, you come up with a risk level, and then they run their models and optimize to buy whatever they're going to buy, but to achieve that 70-30 risk level that we traditionally perceive as what constitutes a stock and what constitutes a bond, because the instruments get increasingly more exotic. And when you have $20+ billion to invest, you have to reach out beyond the traditional instruments and diversify to all sorts of investments to achieve your return objectives. So that is the operative point of it, is we're moving from just this blank statement of 70-30 that it's hard for anybody to really deal with anymore. What does that mean? Because the equities and bonds have changed so much, to where we're going to just set a risk level. So the rest of the bill then falls into place. So now let's backtrack. On page 2, you can see where it says on line 4, it currently says may invest up to 70% of the permanent funds in equities, including stocks of corporations, so forth. We're now going to strike up to 70%, and it will read, it may invest the permanent funds in equities, including stocks of corporations, in accordance with subsection A through E of this section and 94716, which is the one that creates the reference portfolio. And if I were as smart as our chief investment officer, I could probably explain it better than I am. So I hope that that's clear. And then on page 4, again, we say that investments made in accordance with this section, policies adopted pursuant to, the fund shall be invested in a manner to obtain the highest net rate of return consistent with preservation, corpus, and principle. So it's in some ways it seems like a difficult concept, but in some ways it's actually much easier than trying to sort out. When the legislature tells me buy 70% equities, and some of these equities look awfully risky, and when the legislature tells me buy 30% bonds, and some of these equities look awfully safe compared to some of these other bonds, when they tell me buy 30% bonds, some of these bonds look not quite as safe as some of these equities.
I'm feeling a little unsafe.
That's right. It helps put a little bit more definition by saying, take a reference basket and then back into the investment level. And I think our chairman might be able to help clarify anything that I messed up there. Thank you, Mr. Chairman.
You've heard the discussion. Any further discussion? Senator Scott.
Mr. Chairman, I'm struggling with this concept a little bit. So let me ask a couple of questions how it work in practice. Suppose you get to a situation, which I think we may be rapidly getting into, where because of the extent to which our federal government's printing money, the traditional safe U.S. government bond is no longer a safe investment because its value may be just eroded away. It's a practical matter. Would this bill enable us to get rid of such unsafe investments in our investment pool and invest in some other things? First question. Second question is, can the formula here be manipulated so that they could get into some things that really were very unsafe in practice if there hadn't been enough experience to show how unsafe they were? So I'm a little concerned about this reference portfolio and how it might be manipulated to justify some investments that we otherwise wouldn't make.
Let's get over to Senator Anderson, then maybe Senator Perkins will help us out. Senator Anderson.
Thank you, Mr. Chairman. I just wanted to congratulate the senator from Tongue River on the explanation there. He covered every facet of that. in at least 20 minutes there. Good job.
Thank you, Senator Anderson. Senator Perkins. What, we've got another question. I might go to Senator Furphy first, if it's all right. He's a banker.
Thank you, Mr. Chairman. Let me just ask about the term global equities. Global equities typically are only those companies that invest globally. So I'm a little concerned because you don't want to limit it just to those types of equities, but it may not be a problem, but I thought I'd ask that question.
And Senator Perkins, if you could clear up whether we're going to have equities from outer space too.
Okay.
Thank you. We got one more. Senator Rothfuss. Everybody wants to pile on.
Piling on, Mr. Chairman. I'm curious about the global equities question as well, the definition there and how we will arrive at what a reference portfolio is. So more clarification there. But the other question I have gets at what this is specifically modifying and what you're looking at when you're talking about a portfolio that we will compare with. Is this all of our permanent funds taken individually, taken in aggregate? We've talked a lot in the past about the idea of having portions of the funds, for example, that might be higher risk, but looking for much longer term investment yields, where we've got others that are maybe medium term and others that are short term. And you would certainly have different risk levels associated with each of those, but obviously you're going to blend that across potentially different funds. So it's a little bit unclear to me what that represents. And then the third and final question I have is, over the years, and I was just trying to find it in statute before I stood up, the alternatives investments and sort of the modifications that we've got in statute where it's 7.5%, I can't remember what it is, that can be invested outside of traditional equities and bonds. And I'm curious if this affects that in any way. It seems like it's a comparative risk concept, so it seems like nothing is changing in the alternatives language and that you just have to adjust accordingly in your comparison. But I wanted to make sure that I wasn't missing something that was somehow eliminating the alternatives concepts. Those are mine. Thank you.
Thank you so much, Senator Rothfuss. Senator Perkins, you better just talk before somebody else stands up.
Okay, thank you. So we'll go back and try and circle this. So I think, first of all, you have to go back to this concept that, it used to be back, a couple decades ago, you had this thing called the Laffer curve. And you simply invested along the Laffer curve, and ultimately you would be somewhere between 60 and 80% invested in equities and the rest in bonds. And that situation doesn't really work anymore. So what you're looking for in this concept is that you want the highest adjusted rate of return you could have within a certain risk portfolio, your tolerance to risk. And so that's what this whole thing is as you rate the investment that you have and the risk that it poses, you're looking to find what they call an efficient frontier. And that is, as you look on the whole gamut of risk that's there and the returns that you have, you're trying to be out on what's called this efficient frontier, which means that you're marrying and trying to find the optimum level of risk and return at the same time. And I think, and that's what the good senator from the Tongue River was talking about before. When you have equities, you've got equity funds and equity groups that act differently, and that's all changed as we look at these hybrids and this different forms of investment. So as you go back and what you're trying to do, and I think that what you get back, and we'll go back, and this will answer the question about the global equities first. So if you go back to the reference to global equities, and so the reference to global equities is not saying you have to invest in global equities. It's saying that when you perform this risk profile, that it shall not materially exceed. So you're creating an upper limit of what this risk profile will be. And that upper limit of risk profile is a profile of an investment strategy that would be in 70% global equities and 30% domestic fixed income investments. It's not saying you do that, It's just saying you look at that risk factor. When you marry that risk factor, your risk factor that you're going to invest in cannot exceed that. So it's just create an upper limit. It's not saying you invest in global equities or you do that much. It's saying this is how you establish the upper limit of that risk factor. Now, the other things that go into, and the other restrictions you find. So if you go back to page 2 and you look at particularly the new language where we have in lines 4 through 7. So that's why you're striking 70% there of the permanent funds. You're just saying, we're not just, it's not just an upper limit of 70% of these funds. You're saying we're gonna limit it by this risk factor that has global. So it doesn't mean you're investing in stocks over the world. It's just, it has to do with establishing the risk factor, the upper limit of the risk factor. But the other restrictions you find in line 6 and line 7 in accordance with subsections A through E of this section. And subsection A through E of this section in permissible investments are talking about the role of the state investment officer to invest. It talks about the role of the state treasurer in executing the investments. But the real limit is the State Loan and Investment Board, which now consults with what's called this Investment Funds Committee, which are amazing, really incredibly bright, high-powered people that actually donate most of their time. They're very smart and experienced in the world of investments. And they help advise the SLIB board, but ultimately the SLIB board then sets all the what are called the portfolio standards for the investments to be held in. So that's going to be, so they're going to say, we can have no more than 10 to 20% of ours in foreign domestics, or this much in large cap, or this much in small cap. And so the investment board sets all these investment policies, and then the state treasurer is obliged then to not exceed and to invest the state's funds within these bands of responsibility that have been set by the State Loan and Investment Board as they do that. So that's what those other restrictions are. It's the restrictions of the State Loan and Investment Board. They all set this overlay of investment policies so that the treasurer can't go off and invest in just crazy things. And so that's what those restrictions are. And then the other restriction they have is this new restriction saying that whatever you do, we're never going to exceed the risks that would be associated with an investment portfolio that had 70% in global equities and 30% in domestic fixed income securities. So you're just creating these limits that they have to operate within. If we go back and we talk about, so I think that gets to go back to go back through the questions that initially, that it means that yes, you don't have to invest in government bonds necessarily if they get to be very risky. If we go back just a few years ago, we lost 120 million on investment bonds, particularly when interest rates are this low. If you have a very small movement in interest rates now, because we all know what interest rates are in bonds, and we're finding on fixed incomes now are so low that any movement in interest rates up or down have a dramatic effect on the face value of the bonds. And so we found out the bonds just aren't safe anymore. And so, yes, it allows us to move out of that or control that or have other investments that offset those risks. And so it allows us to get out of things that are unsafe and into things that are safer. Again, I think going back to the global equities, again, there's no requirement that you invest in a worldwide portfolio. It's just saying that's what the risk factor is. That's the upper limit of the risk factors that you can absorb is an investment portfolio that had 70% in global equities and 30% in domestic fixed income. And so what you're looking for, again, as you're going back, you're looking for an overall, as you have certain things are invested in fixed incomes, and certain things are invested in large cap, and certain things are invested in alternatives, and certain things are invested in real estate, and so when you get all of this together, then you have this diversified portfolio that then meets these conditions of primary income and capital preservation. That's the overall standard that these things are invested to. And so I think that covers the global equities. Again, that's just a risk factor. Although, there's a certain amount in the investment policy that does invest in emerging markets. and in international markets. Those are valid things, but the State Loan and Investment Board sets a restriction or a limit of how much of the portfolio can be invested in those types of investments. I think we've gone through and answered most of those questions. It's a bit complicated. We've been looking at this for a number of years on capital finance. But again, what it comes back to is just trying to match what's happened in an explosion of different types of investments and forms of investments. The world has changed dramatically in the last decade on what's risky and what's not risky. And so this is the attempt to bring modern investment theory in to maximize returns to the state with an acceptable level of risk. Again, the primary factors are to get as much income and appreciation as we can get within the acceptable risk. But the overall purpose of the plan is income and capital preservation. Those are the overriding principles. And so these are all structured to then allow us to put some limits on so that we're not taking flyers on crazy things. We're moving out of, it allows us to invest in different things other than bonds when we don't think that bonds are investment. I can tell you, for an example, instead of just buying bonds long, over the last number of years, the bonds, we hold very, very few bonds that we buy on issuance. We what are called ladder bonds. You go out and buy bonds with maturities, 30-year or 30-year bonds that are going to mature over the next year, 2 years, 3 years, 4 years, and 5 years. We're laddering those so that at the very worst, the most that happens is we just hang on to that. We at least get the face value of that bond back. So we're not buying bonds. We're not going to auction and buying bonds for the very reason they're too risky to buy and hold. They're too volatile. And so even though we're making a number of changes, again, this simply updates that, puts some limits, and allows us to invest in this with frontier within the bands, the sufficient frontier within the bands and the investment policy that are set by the State Loan and Investment Board, which are looked at very carefully by them. Our State Loan and Investment Boards are 5 electeds. All of them are pretty conservative in how they feel about things. They have the advice of the Investment Funds Committee, and they also have the advice of our investment advisors. We all know who those are, a large firm that advises the treasurer and the State Loan and Investment Board on a regular basis. We have all kinds of oversight to try and keep us within earning as much income we can while maintaining the goals of income and capital preservation. So I think that answers those questions. At least I think it did. And thank you, Mr. Chairman.
Well, if it didn't, it was sure fun, Mr. Senator Perkins. Further discussion on Senate File 19. Further discussion. Ceci, you're ready for the question. The question is on Senator Perkins' motion that when the Committee of the Whole arises to report that it do so with a do pass recommendation on Senate File 119. All those in favor signify by saying aye.
Aye.
Opposed, no. Senate File 119 is passed Committee of the Whole. The next file for our consideration is, oh no, Senate File 120. Let's do this again.
Senate File 120, Investment of State Non-Permanent Funds, an act relating to public funds sponsored by the Appropriations Committee. Was referred to Committee Number 2, which returned to committee recommendation that it do pass. Ayes, Senators Guru, Hicks, Kinsky, Perkins, and Steinmetz. Senator Perkins, Chairman.
You've heard the reading of the file. What is your pleasure, Senator Perkins?
Thank you, Mr. Chairman. I move the Committee of the Whole rise and report that it do so. We're doing 120?
It's on the
Okay.
list.
This is a follow-up.
Is that okay?
Yes, we do what the Vice President tells us. So I move that when Committee of the Whole rise report does with a favorable recommendation on Senate File 120, investment of state non-permanent funds. For an explanation of the bill, ask you to call him the good Vice President.
Thank you, Senator Perkins. Senator Hicks.
Mr. Chairman, I could repeat everything that was just said, but I won't. This does the exact same thing as far as the risk portfolio, but it goes into our non-permanent funds. It does move some of these funds into Pool A, which include the State Fair Endowment Account, the Wyoming Children's.
Can you pull your microphone over, Senator?
Wyoming Children, it brings in the State Fair Endowment Account, the Wyoming Children's Trust Fund, the Wyoming National Guard Youth Challenge Program Endowment Account, Wyoming Military Trust Fund or Trust, the Wyoming Education Trust Fund, Emergency Medical Services Sustainable Trust Account. It rolls some of these into Pool A. It does the exact same things. I would just remind everybody, the importance of this is your interest earnings. And earnings has a little bit different definition in here that brings in the current practice. Has paid for anywhere, but in the last decade, 20 to 30% of your total general funds. This is, we talked a lot about revenue and taxes. This is one area that we're hoping that we could actually generate a little more revenue to provide for all those services that we reduced in certain departments earlier today. So with that, Mr. Chairman, it does the exact same thing, just changes the risk portfolio, moves some of these into Pool A for those investment strategies. Stand for any questions. If no questions, ask for your favorable consideration.
Thank you very much. Are there any questions? Not seeing any questions. So the question is on Senator Perkins' motion that when the committee of the whole rises to report that it do so with a do pass recommendation on Senate File 120. All those in favor signify by saying aye. Aye. Any opposed? No. Senate File 120 is passed committee of the whole. Mr. Majority Floor Leader.
Mr. Chairman, I move that the committee of the whole rise and report.
You've heard the motion. All those in favor signify by saying aye.
Aye.
Any opposed? Senator Doxton. Mr. President.
Good job, Kale.
Yeah, she's documents are candy. I got the brain part up there. You never turned my mic off. Shut my mic off.
Reading clerk will read the committee of the whole report.
Mr. President, your committee of the whole, having had under considerations bills on general file, begs leave to report as follows. Senate File 108, do pass. Senate File 109, do pass. Senate File 2, do pass amended. Senate File 155, do pass. Senate File 93, do pass. Senate File 115, do pass amended. Senate File 74, do pass. Senate File 119, do pass. Senate File 120, do pass. Senator Case, Chairman.
Senator Case.
Mr. President, I move for adoption of the committee of the whole report.
You've heard the motion. All those in favor say aye.
Aye.
Those opposed, nay. Committee of the whole report has passed. The report has passed. Just a moment. Senator Nethercott, are you taking this or Senator Driscoll? Or Senator Perkins? You're taking it.
What am I taking? Thank you, Mr. President. I would just like to move to re-refer. I know I've been trying to do this for a minute. I'd move to re-refer Senate File 133 from the number 1 committee to committee number 10, which is prohibiting abortifacients and chemical abortions. I think I request it. I request
Requested.
the Senate File 133 be re-referred to committee number 10. Thank you, Mr. President.
Absent objection. Senate File 133. Correct?
Do not want that.
Absent objection, that'll be re-referred to committee number 10, Labor Health. So done. Senator Perkins.
Mr. President, having voted on the prevailing side, I move for reconsideration of Senate File 85, property tax reporting and exemption.
You've heard the motion. It appears to be in order. It is not debatable. We will first vote on the reconsideration of that motion. Will the chief clerk call the roll on the motion for reconsideration?
For reconsideration, roll call. Anderson? No. Baldwin? Aye. Whitman? Boner? Aye. Bouchard? No. Case? Cooper? Aye. Driscoll?
No.
No. Ellis? Aye. French? No. Furphy? Aye. Guru? Aye. Hicks? Aye. Hutchings? Aye. James? No. Kinsky? Aye. Kolb? No. Cost? Aye. Landon? Aye. McCowen? No. Nethercott? Aye. Pappas? Aye. Perkins?
Aye.
Aye. Rothfuss? No. Salazar? Aye. Schuler? Aye. Scott? Aye. Steinmetz? No. Wasserberger? Aye. Lightman? Aye. Case? No. President Dockstader? Aye. Closing vote? Closing. Vote closed. For reconsideration, 20 aye, 10 no.
Reconsideration is passed. Now we are on the bill, Senate File 85, third reading of the Senate file. Reading clerk, call the roll.
Senate File 85, roll call. Anderson? No. Baldwin? Aye. Beitman? Aye. Boner? No. Bouchard? No. Case? No. Cooper? Aye. Driscoll?
No.
No. Ellis? Aye. French? No. Murphy? Aye. Guru? Aye. Hicks? Aye. Hutchings? Aye. James? No. Kinsky? Aye. Kolb? Aye. Cost? Aye. Landon? Aye. McCune? No. Nethercott? No. Pappas? Aye. Perkins?
Aye.
Aye. Rothfuss? No. Salazar? Aye. Schuler? Aye. Scott? Aye. Steinmetz? No. Wasserberger? Aye. President Dockstader? Aye. Closing vote? Clo- Cooper, aye to no. Closing vote? Closing. Vote closed. Senate File 85, 18 aye, 12 no.
Question shall the bill pass upon reconsideration, Senate File 85, having received the affirmative vote of the majority of the members elected to the Senate, Senate File 85 has passed the Senate.
Be careful, you're gonna get in trouble. Yes.
Mr. Majority Floor Leader, that clears the desk.
That clears the desk.
Senator Boner.
Oh, Mr. President, I have privilege of the floor real quick,
No.
please.
Go ahead.
Okay, in the South Gower, we have a visitor from Teton County. Maybe you've seen an email from him. If you could stand up real quick. Peter Long is here for the week. If you have an opportunity to introduce yourself to him, he has a impressive resume working for the federal government and now is back home in Wyoming. So we'd like to welcome here to the Wyoming.
Welcome to the Senate, Mr. Long. Mr. Majority Floor Leader, again, that clears the desk.
Mr. President, I move we stand adjourned until 10 a.m. Tuesday, March 9th.
Announcements. Senator Landon.
Mr. President, your Transportation Committee will meet in about 10 minutes down below on the causeway, W2, to take up Senate File 73, I-80, rather tolling authority for I-80 in about 10 minutes. Thank you, Mr. President.
Thank you, Chairman Boner.
Thank you, Mr. President. Committee number 5, Agriculture, will meet upon adjournment tomorrow, March 9th in Capitol Extension Room W2 and online to consider Senate File 135, water rights, livestock on federal.
Thank you. Senator Driscoll.
Mr. Chairman, your lucky committee number 7, corporations, will meet Tuesday, March 9, 2021 at 8 a.m. in Capitol Room W110 to take up the following bills: Senate File 126, real estate subdivisions, easement requirements; Senate File 38, decentralized autonomous organizations; Senate File 145, election runoffs; Senate File 78, real estate appraisers, continuing education; and Senate File 142, prohibition on private funds for conducting elections.
Chairman Case.
Mr. President, your committee number 3 will meet tomorrow over the noon recess, 15 minutes upon the noon recess. And we're going to take up Senate File 92, public hospitals out of county operations. I actually slightly butchered that name earlier. That's why I'm redoing it. So thank you, Mr. President.
Thank you, and thank you, Chairman Case, for taking us through a heavy lifting day. Further announcements. Senator Perkins.
Thank you, Mr. President. Your committee number 2, We Try Harder Appropriations, will meet 15 minutes after noon recess tomorrow in room E301 and online to consider the following bills. Senate File 136, we completed public comment and will work the bill. Senate File 104, anesthesiologist assistance, which is a re-referral. Federal emergency COVID-19 relief funding. We'll also take up, if time permits, state funds, investments and distributions, and also government waste, fraud and abuse, again, if time permits. Thank you, Mr.
Thank
President.
you. Further announcements? Further announcements? You've heard the motion. All those in favor, say aye. Those opposed, nay. Senate stands adjourned until 10 a.m.